The meeting of the Dudley-Charlton Regional School Committee is now in session. It is Wednesday, March 13th. It is almost 6:35. We're at the Shepherd Hill Regional High School, and we'll all stand for the pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'll entertain a motion to approve the minutes of our regular meeting on Wednesday, March 5th. Do I have a second?
Second.
Any discussion? Seeing none, all in favor? Motion carries, it's unanimous. I'll entertain a motion to approve the minutes of the executive session of Wednesday, March 5th.
So moved. Second.
Discussion? Seeing none, all in favor? Motion carries, it's unanimous. We do not have the minutes of the interview, so we'll do them at another date. And approval of the warrants. This evening, we do have warrants to be signed, and they'll make their way around the table. The student spotlight we'll skip for now because they're not here, and we'll take them when they do get here. Citizens Forum, is there anyone this evening that would like to speak with us? Okay. Communications, Dr. Nash, do you have any
I
this
have
evening? None? I did, but that's
Thank
okay.
you.
We're on
Sorry.
communications, and then I'll take you back. Any members have communications? Kathy?
I think it's going to be addressed later on tonight, but I've had a couple of concerns from retired teachers about the change in the insurance policy. So I just wanted to bring that out there, but I know it's on the agenda. We can go into it in more detail later on.
Yeah, and I had some calls too on concerns of the regular insurance and the retirees. So we'll be doing that later on. Okay. And superintendents, no, we'll take Kaylee.
Yes. All right, so I don't
Sorry,
have,
Kaylee.
No, it's okay. I'm sorry. I had to pick up my brother. Now that I have a license, my mom's like, can do it for me. So I'm like, okay. This week I don't have a lot because I did talk a lot about what Shepherd Hill had going on in March last week, but we did have 2 athletes who were able to place at the New Balance Indoor Track Nationals. One of them was a Shepherd Hill junior, Emma Sullivan. She placed 5th in the Emerging Elite Division. And Brian Santos, I had previously talked about him before. He went from placing 1st in New England, all of New England, in the 50-meter dash, and now he placed 8th in the country, in the whole entire country, for his 60-meter dash at the New Balance Indoor Track Nationals. And then we had spring sports. They begin this upcoming Monday on March 18th, and we had record numbers show up last night at the chemical health night and information night for those spring sports. Baseball also had record numbers for their attendance, and they are actually 4 players away from being able to have 4 teams. And this Saturday, on March 16th, the 2nd annual John Pair 3v3 basketball tournament will be happening starting at 9 a.m. at Shepherd Hill Regional High School, and it's going to be $20 per team to register. I think registration closed last week. It was $40 a person. All are welcome to attend, including spectators, and proceeds will be going to the John Pair Student Support Fund. A great cause. And then also at Shepherd Hill, the SAT prep course will be starting on March 19th after school over the course of 6 weeks for just $2.99 per student. And on March 21st, we will have a guest speaker up here at the Hill, Sarah Panzow. She's going to be speaking to the students of Shepherd Hill to tell her story and address the dangers and consequences of drunk driving and getting in with the wrong crowd. And then we also have the 2019 Color Guard and Winter Percussion home show on March 24th at 12 o'clock in the Shepherd Hill Gymnasium, and it will also be a competition that day. I think that's all I have for this week.
Any questions for Kaylee? Thank you, Kaylee. Okay, superintendent's report, Dr. Nash.
Yes, the special topics report is very brief this evening.
as you can see in your packet. At our next meeting, I wanted to let the committee know that we are on target at the next meeting. The Mars consultants, Dr. Stephen Hemming and Dr. Paul Guadalucci, will present their final report with recommendations regarding reorganization. As this afternoon, I received their draft report, which I'll begin to read. Dr. Hemming will be here next week to go over that with me, and we're on schedule to present to you, or they are on schedule to present to you their recommendations and findings on the 27th. Also, you have in your packet from the high school, this is 3 months worth, so don't anyone panic when you see this. Some of the suspensions for the reasons that are outlined below for January, February, and March. And that is my special topics report this evening.
Oh, thank you.
Brief.
Any questions for Dr. Nash? All right. And that brings us up to new business and report of the district auditors, Powers and Sullivan.
Good evening.
Good evening.
Rich, do you want me to just go right into it?
Yes.
Might as well.
All right, great, thanks. You have probably in your packet some our reports. There's 3 reports. One is the financial statements, another is a report on your federal awards, and the other finally is the management letter. I'm going to take them in that order if I can. If there's any questions along the way, I'm more than happy to answer. I've got some prepared notes, though. So thank you for letting me be here tonight to just go over this with you. What I'd like to do is just kind of tell you how about we go about the audit, tell you the things that we tested, also talk about what I think are the results that you should be aware of as what's in those reports. We do the audit in 2 separate time periods. We usually come in late spring. This year we came in May 29th, and we spend 3 to 4 days out here. And we do all the things that aren't specific to June 30th, such as the budget. We try to get the single audit done. If the OPEB is available, we do book that liability. Net pension liability, the same thing. We do transaction testing on payroll, revenue, your expenditures, as well as looking at journal entries. Bonds payable, usually everything has happened related to bonds payable, so we can audit that. And finally, you have some capital leases still in the books, and we take care of those. June 30th comes, the books gets closed. We came out here the week of August 1st and spent about 4 days in the field. And there, what I call is we walk down the balance sheet. Your primary assets are cash and capital assets, and your primary liabilities, in addition to the things I've talked about, are accrued payroll, comp abs, and also warrants payable. The others, the big ones, the elephants in the room are the pension liability and the OPEB liability. Those are really big on your balance sheet. So that's what we do. Now, just to give you the scope of it, the biggest thing we pay attention to, honestly, is cash. You had $10.5 million of cash as of June 30th. It's the kind of asset that can grow legs, and we want to make sure that it's right, and it was right. All the other ones, basically on the liability side, are pretty easy to determine. In fact, we have actuaries help us with the OPEB liability and on the pension liability. Accrued payroll is just teacher summer pay that we take a look at. Get the journal entries for that. So for the most part, we spend a lot of time on the asset side and on working on cash. Now, one of the things that's important for us is to have our audit team ready from a planning standpoint, but also when we come into any client to have them ready for us. And what I can share with you is both on the prelim work and on the year-end work, the business office was ready. They were ready for us to come in. They had the information we needed. It was waiting for us when we got there. And when you can sit there and basically plan out the audit with all that information there at the beginning, it doesn't get better than that. That's how good it was. I'd like to share that with you that Richard and his team were what I call focused and exhibited a sense of urgency. Because what we do is we have to do certain things the same way every year, but we have to also come in and using professional skepticism throw a couple of curveballs, ask for things we haven't asked before. And they got us the information timely, it was accurate, and what it meant was, in my mind, when somebody gets the information that's both accurate and timely, it means that they've got a good control of their records. They're not looking through papers trying to find things. So just to sum it up, the info was complete that we received, the info was accurate, and again, received in a timely manner. The results. Basically, we've got an unqualified opinion, which is our way of saying it doesn't get better than that. Important, too, is that we required that no audit adjustments be made to the books, because that would have meant if that had occurred, that you would have got something, or maybe had something to look at that wasn't correct somewhat time during the year, and that was fine. We have no issues to report about internal controls. Again, it was a good, clean audit, and we had great cooperation with the staff. The results. I tend to focus on the budgetary results because that's how you manage the district. Operations reported a $279K loss, but that was much better than anticipated because you had anticipated to use $1.1 million of E&D. So when you think about the loss, you had planned for a larger loss, and it didn't happen. Revenues came in about $352,000 higher. Most of that was the Medicaid reimbursement. Expenses came in $468,000 lower. Total budget was 49.9. That's about, you were about 95% of budget with that excess. Most of this tells me that your budgeting process is fairly sound, and that you do reasonable expectations of revenues, and you manage your expenditures well. The biggest pieces of liabilities on the books are the net pension liability and the OPEB liability. The only new thing this year relative to the financial statements is implementation of GASB 75. Your previously reported OPEB liability was $13.2 million. GASB 75 threw out the old way of doing it, which was GASB 45, and said, book the whole liability on the books now. At year end, that was $30.7 million. So you went from a $13 million to a $30.7 million, and now the whole thing's on your balance sheet. You also are required to show your share of the $816 million unfunded liability of the Worcester Regional Retirement System. Your net pension liability on your balance sheet was $13.6 million at the end of the year. And there's this thing called deferred outflows of resources and inflows of resources, which I don't want to explain to you because it's very difficult to do so, was $1.2 million relative to that. A couple of other things. The health trust rebounded nicely. This year, the total surplus in the trust was $1.8 million, and it was a result of an increase of $1.3 million in FY18. I don't know if you remember, but we were constantly bringing it up that this was not funded correctly, and it seems that you basically turned the corner on this, which is great. Capital asset activity, a little bit, $746,000, several vehicles, a piano, which I thought was kind of cool, I forgot about that, and you had to do some repairs to the generator were the primary things relative to that. As debt activity goes, there was no short-term debt activity this year. No long-term debt was issued, but you did pay down $3.3 million of long-term debt. I believe you have about that much left to be paid off next year. That's the highlights of the financial statements themselves. I'll just talk about the CFA. The Schedule of Federal Awards. You spent $1.9 million in total federal awards. Now, we have to issue this report because you spend more than $750,000 of federal funds. The $1.9 million is exactly the same amount as you spent in 2017. We tested the special education cluster, which was $854,000. 3 opinions in there. There were no findings, there were no question costs, and you had a good, clean opinion on all 3 reports. This is important to us because this is the part of the job that there is a risk associated with it. And what I just want to share with you is that they did well. Again, no findings, no question cost. Finally, there's the management letter. We had 3 comments, actually 4 comments, but they kind of folded into one. We had a comment regarding accounting policies and procedures, and we had a finding regarding financial policies and procedures, which are slightly different. Related to both of them, a draft has been developed. In fact, Rich, I reviewed that, didn't I? Did I review that for you, the financial procedures?
Yes.
Okay, I thought so. There's a fraud risk assessment that's still outstanding a little bit, but they're working on trying to get it done. We have communicated with some people who do a good job of this. It's been my recommendation, it still is, that you have somebody outside of the place do it. And we can't do it because we have an independence issue. So, there's some really good people that work on this. I've shared that with Rich. And I think my anticipation is you'll probably have that completed by the next audit. And finally, there's one item that's still open. It's a formalization of some of your internal controls over federal awards. It's an informational comment because it's really, I know that you have the controls in place. When uniform guidance came out, it basically said you have to document what they are. And it's specifically to federal awards. It doesn't have to be the entire school. They got this thing called COSO, which is the Committee of Sponsoring Organizations of the Treadway Commission, which is how the SEC follows its rules. Basically, they want you to do some of your federal awards using those milestones. So it's basically simple. Document how you process federal grants. That's the management letter. If I was in your shoes, I'd take a look. I'd be looking at this and saying, I think we're in pretty good shape here, and I don't have anything to worry about. This is what I want to leave you with.
Any questions?
I'd just like to say that I would like to send a letter to the staff to tell them what a great job. Every year you tell us that our staff.
It's been true. We
it's
kick the
such a short-
tires.
Right.
There's such a few people up there doing all that work.
Yep.
They deserve to commend it, please.
And I will say, Mr. Sullivan's staff is great. Indeed, they did throw a couple of curveballs to us this year, and
To catch them.
I think we hit them appropriately, let's put it that way.
Thank you.
Thank you.
Thank you so much.
Thanks for getting me on the
Thank
agenda
you.
early, too. I appreciate it.
Rich, do you have anything to say before
Sure.
Chris starts?
So, as the committee is aware, for about the last 9 months or so, we've been engaged with group benefit strategies to look at forming a joint purchase group. The initial list of invitees was around 20 or so, is that correct, Chris?
Yep.
From my memory. We had active participation from 5 to 7 groups or so, I think, from that. And where we are right now is we have drafted a agreement, not signed, and, you know, obviously that's one of the reasons that Chris is here to give the school committee some information about this, with the towns of Webster, Douglas, and an outlier, Stoughton. 2 original members, Southbridge and Millbury, have both withdrawn from the process for right now, for this year, and actually for the next 2 years, for their own individual reasons. So it's interesting. You heard Mr. Sullivan talk about being self-insured and where we were when I first started here 4 years ago, and where we are now. Inevitably, with health insurance, you're going to have good years and bad years. We've had a couple of good years, as well as you know, some good strategies to help increase our profit level in the insurance trust. And this is just another way of trying to provide the same level of benefits on an ongoing basis to our employees for the same or less cost. So when you can provide the same or more for the same cost or less, that seems like a good situation to be in. However, when you're part of a group, you do give up a little bit of autonomy. And so there are pros and cons to this, and we have to be aware of that. So I'll turn it over to Chris to do the presentation, Mrs. O'Coin, if that's okay?
Yeah, that's okay.
Thank you. So I guess I'll first introduce myself. My name is Chris. Not only I do work with now Gallagher Benefit Services. We consult for about 200 municipalities in the state of Massachusetts, 175 of which are in one of our 8 joint purchase groups. So there are 10 joint purchase groups in the state of Massachusetts. We consult for 8 of them. So that's what we do as Gallagher. As far as the joint purchase group goes in this scenario with Mass Strategic Health Group, as Rich said, I won't repeat too much of what he said, but back last summer we all started these discussions about what it might look like to join together and why you would join together. So I guess I'll go over kind of the whys and some of the challenges that you might see. So why would you want to join together as a larger group? So right now Dudley-Charlton's been self-funded. They have been so for quite a while now. Also, the town of Webster and the town of Stoughton also are self-funded. So some of the reasons that you want to be self-funded are so you can control your costs, lower your relative fixed cost, and have a little bit more stake in your own future. So the only difference here is joining together as a joint purchase group. Those advantages only become stronger as you become a joint purchase group. So when you become a larger group, if claims are all relatively the same, what you see is lower fixed costs. By lower fixed costs, you look at things like your administrative fees. So your administrative fee is something that you pay to the carriers, right, to process your claims, provide you with customer service, and hopefully a level of disease care management as well. Anyone have any questions of what the admin fee does? Yep. So that's basically why you pay your admin fee, right? So that becomes relatively less the larger you are. Also, another reason to join together is there's what you buy in be a self-insured environment is reinsurance. So that way, if someone gets really sick, the reinsurance carrier comes in and help pays those claims. Again, the larger you are, the relative cost of that goes down, right? Because the idea is that your claims are your claims are your claims, right? So if you could lower your relative fixed cost to the lowest possible amount, it provides savings, right? Because you're still going to have your claims no matter what you do. Another reason you join together is to start doing things to affect your claims, because again, that's where your largest pool of money is being spent. As a smaller self-funded group, you don't have access to some of these vendors that help come in and help again, do some disease care management around cancer, diabetes, so on and so forth. And what that does is allows your population as a whole to get healthier over time, and thus reducing your claims in that way as well. Another benefit of a larger group is it allows you to carve out drugs, which allows you to direct contract with a pharmacy benefit manager, which more or less deletes the middleman out of some of the carriers that we currently work with, right? And allows you to get what's called rebates, because a lot of what goes into your cost of drugs is called rebates. It allows you to directly get that money from the pharmacy benefit managers and the pharmaceutical companies back into your own trust fund. So there's savings in a lot of ways. I would say those are your 3 or 4 biggest savers. As far as your...
Is that reinsurance the same stop loss?
Yeah.
Correct, yep,
That's the-
sorry.
That's what we know it as stop loss.
Oh, I apologize, so stop loss.
So it's reinsurance means.
Yep, so reinsurance and stop loss, they're both interchangeable terms, I
Do you
apologize.
know how much that's going to be? Is it 100,000 when the stop loss kicks in, or
Yep, so we have the attachment point at $110,000.
110,000?
Correct.
Is that we always had it at? Is that what it was
Ours,
before?
ours here currently is 100,000.
That's what I
Yeah,
thought. So
that's
this is
what
a
I
little
thought.
higher.
Yep, so some of the benefit of being a larger group is you can take on a larger spec point because you have more money coming in. That's important because the larger you get as a group, the lower you want your stop loss coverage. I mean, the higher you want to build up your stop loss coverage. Because again, your single goal when you're self-insured, except for being able to customize your plan to your group, which is arguably the most important part, is as you get larger, the more money you have inside of your trust fund, right, it allows you to up the stop loss level, which is important because that lowers your fixed costs. Again, the goal is to get your fixed costs low because your claims are variable and by far the largest piece of your spend. So that's why we're at 110,000 compared to where we are at 100,000 now. So that's some of the rationale of why you want to start, why you want to be part of a large group is, again, so you have your lower relative fixed cost, you have your your more predictable claims, right? Because as Rich said and as the auditor just said, there's been some fluctuation in the trust fund in Dudley-Charlton, right? So some of the idea of being part of a larger group is you have more people as part of that group, so it allows your experience to be very predictable. By experience, it means once you start and build a large group, law of large numbers says you're going to have a certain population that's sick. You start to know what that population is going to be, right? So it's very predictable risk year over year. So again, the larger you get, the more predictable that risk is.
Now, the stop loss, everybody's going to have the same carrier for the stop loss insurance
Yes,
in the
correct.
towns? Okay, now we've got four towns, right, in the purchase? Is anyone coming in with a different carrier? That was my question I had asked you once, and I thought you said yes.
Yeah, I believe.
You said
that this-
Douglas or someone was
I believe
coming in?
Douglas is currently on Harvard Pilgrim.
Yep, so, but they're not, so no one's coming into the joint purchase group, it's separate. So once you're part of the joint purchase group, you will have.
No,
it
I
should-
know, but they're all going to be under Harvard Pilgrim. That's my
Correct.
question.
Oh, I apologize, yes,
Everyone, the four?
correct.
Okay.
Yep. So to go back, so I think I was about talking about the negative. So I just went over all the positives that comes from being part of a joint purchase group. Some of the negatives, to Rich's point, is that you will lose some of your autonomy, right? So right now, if Dudley-Charlton wants to change plan designs, if they want to raise their own spec, they have total control over their plan design in their current plan. Underneath the joint purchase group, you lose some of that autonomy. Now, saying that, it's in the agreement, I mean, it's been agreed upon that we will not change plan designs for at least 2 years. Rich has made it very clear to that board that there will be no plan design changes in the future unless something catastrophically crazy happens. And then at that point, like a little bit different than other joint purchase groups is, you're allowed to come and go, you're allowed to leave the group after 2 years, as long as you let us know by the end of December. So it's a bit different in that way. Also, there's unlimited access to your own data, again, which is a bit different. So it puts you in a position to know what your pool is, to understand what's going on within your population, but also gives you the advantage of a much larger pool. Please.
You said you won't change for 2 years. If Webster comes in differently from us, they're going to have a different plan and different premiums for 2 years, they could still do that?
Absolutely. So, no, in perpetuity, that could be the case. So in most of our joint purchase groups, if not all of them, there's multiple plan designs that are offered. So when you look at a joint purchase group and you look at plan designs, you almost look at it as a menu, right? So you could select, as a district or as a municipality, you could select from that menu which plan designs that you might want to offer to your group. So I don't foresee that ever changing.
So it can all be 4 different plans, even though we're part of the same group, we can all have different plans?
It is 4 different plans.
Absolutely.
Because you're going with the towns. Like Webster will have a different plan design, Dudley-Charlton has a different plan design, Douglas has a different plan design. They're different. So they can't choose like Webster's
I
plan.
know that, but we're not forced to all pick the same 4.
Absolutely not.
For 2
no.
years, we don't have to either?
Yep, yeah, no, absolutely not. So some other joint purchase groups and the GIC are kind of pushed into plan designs. That's not the case with this group whatsoever. I would imagine that Dudley-Charlton's plan design, unless this body here decides to change that plan design, will never change until at this table it gets decided, and then that will percolate up to the joint purchase
So all
group.
4 entities will have different premiums then?
Yep, correct, yep. So if you have a
Depending on
different
our
plan
plan.
design, your risk is gonna be different, right? For example, in Dudley-Charlton, when you offered your deductible plans, compared to what you had before, your cost changed.
Right.
So every plan design gets underwritten and actuarially looked at, and you get a rate for that plan design. Does that make sense?
Yeah, I understand, yeah.
Yep. So again, so this group, I guess now would be a good time to jump right into the presentation, because some of this stuff's gonna be
Okay.
within there, but please keep asking these questions, because they're important. So we kind of got through the introduction already.
You didn't mention about doctors. It says, can you keep your doctor?
Absolutely, yep, and we'll get to that as well. Yep. No, but please, keep that. So we got through the introduction. So basically, a lot of folks have 3 very basic questions. There's several questions that comes into healthcare because it's a very personal thing, but there's 3 basic questions you typically get. Number 1's gonna be, will I keep my same plan? Right? Number 2 is gonna be, will I keep my same doctor? And then number 3, inevitably, is what's it gonna cost me, right? So I guess we'll go in, if it's okay with everyone here, we'll go into, will I be able to keep my same plan? Oh, sorry, I apologize. Okay. So the answer is yes. So part of what we're doing here is we're with a company called Health Plans Incorporated, which is a fully owned third-party administrator. It's the self-insured arm of Harvard Pilgrim Healthcare. So some of the advantages to that is the following. So oftentimes when you switch carriers, right, so what this shows you here is on the top, this is the very macro level. What we're showing you here is all the plan designs, yes, are being mirrored. And Health Plans Incorporated has said we are mirroring every plan design, even to the nitty-gritty. So for example, other municipalities have tiered hospitals. They even agreed to the tiering that they're currently under. So underneath administrative services only contracts, which is your ASO contract, that's your typical stuff you see out there, right? So when you go from one carrier to another, even though we're matching these plan designs that you see in front of you and on your sheet here, oftentimes there's minute details that you're gonna miss, because what happens is with those carriers, they have to file those plan designs with the state. So they're locked into those, although they're gonna match you on the big macro things, but the little things, the nitty-gritty sometimes can be missed. Part of the advantages of being part of Health Plans Incorporated is that they're able to match the minute details of your plan design. And that was an important part of selecting them, because no other carrier that we talked to was able to match even the minute levels of detail that they did. So that's part of why we select them. So again, you will be able to keep your exact same plan design you have today. You will have, should you decide to do this, July 1st of the new plan year. Any questions on your plan designs?
That was one of the important things that we had to make sure we did in this joint purchase group. as Chris indicated, with many other purchase groups, you ultimately end up into communal plans, plans that are the same for multiple communities. But knowing the population here and knowing the fact that we just went through a rather big change a couple of years ago, it was important to me that we structure this so that we get the benefit of being larger in those places such as admin fees and the cost of reinsurance, but keep exactly what we currently have. And we're able to do that currently with everything that Chris and GBS has come
So
up
the
with.
future, I'm thinking of the future now, after 2 years. Suppose this plan design changes, and it's a lesser insurance or something like that.
Our plan design will only change if we want it to. If the other 3 members of the group were to say, oh, we want to do what, West Suburban does, excuse me, and that's only have 1 or 2 plans for everybody, then we would be in a position to make the judgment as to whether or not we wanted to do that. And if we did not want to do that, we would have the opportunity to leave the group.
Okay.
We're locked in for 2 years, and that's it.
But during those 2 years, through the chair, sorry.
Go ahead.
What I hear you saying is that our plan isn't going to change unless this body changes it. So we will stay where we're at for 2 years. And at 2 years, if everybody else decides to do something different, then we have this opportunity to consider staying in the group or leaving. Okay.
I think we have to realize it's the same plan, but with a different carrier, which is the concern that I heard from people.
Oh, for sure. And so I think it's why the question gets addressed
Right.
within this. So when we go through this packet, I think it alleviates a lot of those concerns, right? Because change does inspire, worry, right? Because oftentimes in the past, when you've changed carriers or changed whatever the case might be, again, there's going to be these minute differences. And again, there will be some changes, and we'll get into what those changes are. But as far as plan design level goes, there will be no changes in that level. And that's important because oftentimes, frankly, in our experiences, every time you switch carriers, on the top, it looks like everything is matching. And 98% of it is factual. It's true. Even 95 probably percent is exactly matched. But there's that 5% outliers. The beauty of what we're offering here today is that it's 100% match, and it's guaranteed by Health Plans Incorporated to be 100% match. So that's an important step to realizing that, again, there's going to be some change. There will be a different customer service number. You will have to give your new card to your doctor. You will have to give your new pharmacy card to your pharmacist. The folks that are on mail order, we're going to have a mail order file that will carry over, but they will receive their drugs from a different mail order pharmacy. So those will be your core changes. But beyond that, there won't be any additional out-of-pocket costs. There won't be some surprise when you go to a chiropractor that, oh, this little change that's not up on that sheet that I just showed you did change, because they are verbatim copying that plan design. So that's important to remember.
Now, in the teacher's contract, and Jamie, I know you're on the negotiating team, they don't spell out the carrier, but it does say the insurance should be equivalent to what they have. Am I right in saying that right now?
It actually
Don't they have a clause?
It does actually spell out the carrier, but we're.
Oh, it does?
But
But you're in the, I didn't
we're
know that it
negotiating
spelled out. I
for
thought it
language.
said equivalent. It spells out Blue Cross Blue Shield in the contract, Rick?
It spells out the name of a plan without listing the plan design.
Correct.
I believe the language does say or equivalent. But
does.
again, it's simply a name, it's not a plan design. It's not listing what the actual plan is, other than the name. So the plan design within that name could have changed 7 different times. So we want to tighten that up within the
They'll
contract.
have to.
But to
yeah,
your
tighten
point,
that up.
we're aware of that, though.
Oh, okay.
But to your point, yeah, this isn't even an equivalent plan. It is the exact same plan.
Yeah.
That was important. So there's negotiating things that you have to worry about too. But as far as the plan designs go, it will be the same exact plan design. So that's important to note. So I think that covers that. Will my plan design change? Because that's an important conversation to have. The next conversation is, will I be able to see my same doctor? That's also important, right? People have long-standing relationships with their current doctors. That's not something that you want to unseat. So again, when we looked at carriers, one of the driving points was, heck, you had to have an equal or better network that you could offer our group, and there has to be minimal disruption. So if you take a look at this map I'm sorry, this page right here. You jumped ahead of me. So what another advantage of being part of a larger group is it gets insurance carriers and third-party administrators to get a little bit creative to earn your business. So part of what we're looking at here is not only do you have the Harvard Pilgrim Network inside of the state of Massachusetts, Northern Connecticut, Vermont, and Maine, you also, wrapped around that network, you have the United Healthcare Network, which is the largest insurance carrier in the country and has the largest network within the country. So for example, if you had a kid in college, or if you're an early retiree and you don't live in the state of Massachusetts, or New England, I should say, underneath your current plan, you'd have to be on the expensive PPO plan. That causes more money out of your pocket and also the district's pocket. So when we looked at this, we had to say, all right, what can you offer us? And what they offered us was, we'll wrap that United Healthcare Network around the Harvard Pilgrim Network. So now, if you live outside of the state of Massachusetts and you're an early retiree, you have a son or daughter that's in college, they can go to an in-network doctor anywhere within the 50 states. So that's a huge difference from what you currently are offered. It's right now you have to stay in New England if you're going to be in that kind of plan. Now you're allowed to be nationwide. So it increases access to care for a lot of members that would have to be an otherwise more expensive plan. So we thought that was important.
I asked that, if I was living in Florida, what do I do? What would I have to do right now, right in this plan that we have now? I'm retired to Florida, how do I get my medical service?
Yep, so it depends on where you are. So it's either you're an early retiree or you're a Medicare retiree. So we'll talk about the early retiree because that's kind of the folks we're focused on today. If you're an early retiree right now, you have to be in the PPO plan. That's the open network plan, right? Not only does that come with a higher premium, right out the door, right, which now you have to take on that higher premium. The district has to take on that higher premium. And then your out-of-pocket costs are going to be higher because your added network coverage comes at a higher cost to you even when you go to see a doctor. So you get hit not only on the premium side of that, you also get hit on your actual out-of-pocket costs when you use your plan. Underneath the new plan, you have it's just as if you stay within the network. So as long as you stay within the United Health Network nationwide, you're going to fall under the HMO network. Actually, I'm sorry, the EPO network, meaning that you can go and see an in-network provider. That was not available to you before.
So the co-pays and everything would be the same?
Correct, absolutely. Right?
That's the regular insurance, but now, after, is it 1984, teachers are eligible for Medicare because they pay Medicare tax.
Yep.
So this is going to be anyway phased out after.
For
Some
sure.
retirees now, they're not eligible for Medicare, so they did have to take the PPO.
Oh, yeah, for
But
sure.
most people now will be on Medicare.
Yeah, probably in 10 years or so, maybe, hopefully longer than that, that population may not need that kind of service. But all your folks that have families that have kids in college certainly can use it. And when you're on vacation, for example, underneath your current plan, if you went to an urgent care facility, you would have to call Blue Cross Blue Shield, let them know what happened within 48 hours. Underneath this new plan, as long as you go to an urgent care facility that's within the United Health Network, which again is the largest network in the country, it'll be covered as an in-network expense. Any
So
questions?
right now, you go to urgent care, you have to call?
Correct.
I didn't know that.
Out of state.
Oh, out of state.
Out of state, yeah, I
Okay,
apologize, yeah,
out of
absolutely out of
state.
state, yeah, sorry.
All right.
Yeah, you do not have to call. Please do
Yeah.
not call.
That's what I was going to say.
I don't want you to flood Blue Cross's line, so
No.
that's not the
Out of
case,
state.
right? And you also have to look at how your added network claims come in and how they're negotiated, right? As far as your claims costs coming into the trust fund, it differs from carrier to carrier, right? So again, though, because you're in the network, right? Now it's just the claims get paid at a provider predetermined cost. Does that make sense to everyone? So there's no like negotiated savings. There's none of that stuff going on, which can get very gray. It's just here's the negotiated cost for a knee or surgery, whatever the case might be. That's what we're paying. You're in the network. Any questions on why it's a decently large advantage to be inside of a nationwide network plan? All right, so that's what we're looking at for the nationwide. But let's talk about actual disruption to employees or possible disruption from the current network to the new. All right, so when we looked at this, we looked at, sorry, everybody. So we looked at three different things when we looked at network disruption, right? Because we want to make sure, again, this answers the question, can I see the same doctor that I see today, can I see them tomorrow? That was important to us, too, when we were looking at a carrier choice here. 100% of primary care physicians that people are seeing today in Dudley-Charlton Regional School District, they could see July 1st if you decide to move to the new plan. Again, important thing, those are the people that you have your strong relationships with. You want to make sure you keep those. 100% of the hospitals are going to have folks that went to a hospital within Dudley-Charlton Regional School District. Those folks can go to the same hospital come July 1st as well. 100% of outpatient facilities. So those are things that are smaller than what you would need for a hospital. Like, for example, maybe if you nicked yourself while you got infected, they had to get in there and cut something, that would be considered an outpatient procedure. 100% of those are also covered within the new network. Any questions on what I just said? I just rambled off a whole bunch of stuff. Where there is some network disruption, from what we can tell, is behavioral health, alcohol and drug rehabilitation, chiropractics, the other kind of providers. I never can remember the name of this. The people that do the needles. Thank you, acupuncture. Some of them may not be in the network, but some of this is a challenge on how different carriers report their data. Blue Cross Blue Shield reports from, at least how we were given the report, I should say, reports nurse practitioners up to doctors, up to providers, and that's how they report the folks that are seeing providers. Harvard Pilgrim's a little bit different. They go provider to doctor, and they never get down to nurse practitioner level. So a whole bunch of nurse practitioners flew into the doors, and it seemed like there was a whole lot of disruption. They were able to eliminate about 85 of those and said, yep, they are in the network. They do report up to the provider. On top of that, you're looking at folks that retired. If they retired, obviously that's going to be a disruption. They're no longer going to be in the network. If that doctor goes from, let's say, UMass of Worcester to UMass of Boston, that doctor now is going to show up as a disruption because they're not part of that original network. So there is some disruption around the things that I kind of highlighted, which again are the behavioral health, alcohol and drug rehab, and chiropractics. That's the biggest difference you're going to find between Harvard Pilgrim and Blue Cross Blue Shield's network.
Physical therapist, occupational therapist?
Yep, that's all included within that.
That would be part of that?
Correct, yep.
That's probably a large portion of where our...
So let's talk about,
Sure.
97.89% of all those claims dollars, so there was about $4.5 million in claims spent in those areas, those other specialties. Of that, 97.89 of those claims dollars were spent within the new network. So there is going to be some outliers, and what I will say, HPI is committed, and they've already done it in a few cases, of recruiting those folks in. So what we'll say, and everyone will be getting a link to look up their own providers, is if you look up your provider, they're not in there, percolate that information up, and they'll go out and recruit that provider. Oftentimes, insurance carriers have the same negotiated costs within a few bucks, so it's a matter of, for whatever reason, they haven't been brought into the network. Again, but it could also lead to those other three reasons why they just didn't show up in the network disruption report. Does that make sense? So again, so when we look at a partner carrier, you want to make sure, A, we keep the same plan design, B, we can keep the same doctor. If those two things are true and accurate, you want to look at cost, right? So that's this next page. So I kind of did this page and I did a summary page next. I just didn't know how big this room was going to be. This would be pretty challenging to see from far away. Can everyone see that clearly? All right. If it's okay with everyone here, I'm going to go to the summary page for them, and so that way we can look at the minute details. Better? Cool, thanks. All right, so again, with all that being equal, we want to look at cost. There's a 9.6% reduction in PPO costs for moving to this new joint purchase group, Mass Strategic Health Group. There's a 6% reduction in cost from your largest population, your Network Blue New England population. And again, there's a 4.7% reduction in your fairly small Network Blue New England $1,000 deductible plan. It equals out to a total of $527,000 worth of savings for employees and employer. To the right side, which you can't see on that, but I'll read them out just so it's helpful for everyone in the crowd. Employee annual savings on your PPO individual plan annually will be $334. Family plan will be $752. Again, that's for your PPO plan. For your Blue Cross Network Blue New England plan, folks, your individuals are going to be saving $166 annually and $334 for your families. The $1,000 deductible plan, $115 of savings for individuals and $205 for families. So there is an immediate year one reduction in cost with joining this plan. That's before we get into the other things that we spoke about before with the disease care management, the actual ability to start curbing your claims down the road. So again, not only do you want to look at this as a year one savings, because that is wonderful, you want to look at the possible savings that you can entertain in years to come as well by partnering with the right carriers, the right vendors to help actually control your disease care states, give these people some help that are going through challenging conditions, and hopefully drive down the cost and improve your quality of care. That's what we're looking at for that. So,
And I have a question.
Please.
Because I know this is all regular insurance.
Yep.
Now, for the retirees that have been asking us, I know theirs goes from January until December, so we really haven't negotiated, but are they going to have the same plan that they have now, maybe the different carrier, but is it going to be the same plan? Plan design, in
Plan
other words.
design,
Yeah, I
exactly.
mean, plan design.
yep.
So the
Sorry.
same as this regular insurance, it's going to be the same plan design.
Well, the same as they currently have.
Yeah.
Through the MedEx.
Right, right.
Yep. So again, their access to care will be the same, their plan design will be the same, their formulary will be the same. These are all important
Yeah.
things. As important as they are
And they
to,
have a different carrier.
correct,
Right.
yep. As important as those things are to active employees, I could promise you, and everyone knows this better than I do probably, to retirees, it's very challenging to see all these changes coming through the mail. So we want to make sure that we minimize those. Part of the reason why we didn't look at changing the Medicare population plan July 1st, which would have been maybe easier from an administrative side point, it would have disrupted them mid-plan year, which is just, it's not really acceptable to do to your retirees unless you have to, and we just didn't have to. But for January 1st, we will be looking at that population too. We'll be going out to bid for those services in the summertime with a move for January 1st. Any questions on the year one savings, the rates here before we move on?
You might be going to answer later on, but the question I was asked is, what % of claims does Harvard Pilgrim reject? Because I've heard that people have had problems with the claims.
Yep, so that's a good question. And what I can do is I could circulate, I don't have that question off the top of my head, that's for sure.
Do you have any kind of ballpark figure?
I know they showed it on their PowerPoint. I could look it up. It's certainly in the 90s that they accept. But they have, again, protocols that they score perfect on, else they give us money back through their admin fee. I can circulate that answer to the board, whatever way I have. I don't have that answer off the top of my head.
But that's a good question.
That was a big question that
Yeah.
was asked. And the other question is, why wasn't Blue Cross considered? Why
Yeah,
not?
it's a good question.
Yeah.
So I think that's important to note too, because I think this change certainly would have been an easier conversation should Blue Cross have been part of it. I'll let Blue Cross speak to why they decided not to be part of it, but I promise you, we went out to bid originally, and we asked Blue Cross to be part of this strategy. Their first inclination, the last day it was due, they told us that they were not going to bid on this group. So what we did is we set up a conference call with people that are very high up in my company. We're the second or third largest, probably the first, second, or third largest consulting firm in the state. We have Blue Cross's largest book of business. So we called them and said, hey, what's going on here? Why aren't you bidding? And they said, all right, well, let us rethink about this now that we've had this conversation. Give us, and they basically, I don't want to speak, so we gave them another 2 weeks to bid on this group because we thought it'd be important to get them involved. Blue Cross Blue Shield again on the last day before it was due said that they decided not to bid again. So I'll let them speak to why. But what I will say is what I will say is 3 of the 4 current groups have Blue Cross Blue Shield separately. Part of what we're talking about here is administrative savings. If you join together as a larger group, that administrative savings comes from the carrier. I'm not saying that was their rationale. I honestly have not received the rationale from Blue Cross and why they decided not to bid. I can only make my own observations and from what I've seen in the marketplace. I think it's unfortunate they didn't bid. I think it's a mistake long-term on their part. But in 2 years, or 3 years, they'll have the opportunity to bid again. But I promise you, they were fully part of this.
So it was their choice, not yours.
Absolutely, yeah, no, absolutely. So we went out to every carrier. Every carrier that we went out to bid for came back with a proposal, except for Blue Cross. And again, I haven't gotten an ironclad reason. It's just that they decided not to be part of this.
How many proposals did you get?
6 or 7.
And this was the best?
This was from a network perspective the best, from being able to match the plan designs exactly the best, and also from a cost perspective the best. So it really was a 1-2-3 punch on that one. Any questions on the financials?
If I may. Certainly, Blue Cross Blue Shield not bidding was a disappointment for everybody sitting around that table. When the first bid came out and they weren't part of it, we were very surprised, and we said, what can we do to encourage them? And it seemed like, Gallagher was going to do the appropriate outreach to prompt them to get them to bid, and ultimately they chose not to, again, for whatever individual and specific reason. But it was disappointing to all of us because, as Chris indicated, and I think as everybody here recognizes, if we weren't talking about changing the provider and we were simply talking about doing the joint purchase group, it would be a much different type of conversation. But to get back to Mrs. Kabala's question about how many claims Harvard Pilgrim denies, Chris, during the presentation over at Heritage Elementary School earlier today, didn't you indicate that because we're self-insured and we're still doing a self-insured group, that we have much more latitude over that?
Yeah, absolutely, yeah. So as a self-insured group, at the end of the day, if you appeal that claim, eventually that gets to the board of the joint purchase group. And if it's something that's clearly flagrantly wrong, which frankly I have not seen it in a joint purchase group that's percolated up to that manner, which they've approved a claim after it's been denied, then of course we'll take that up. But what I will say, they put very real guarantees around their claims processing time, their claims processing acceptance. So what I can do is I could ask them what their percentage of claims that they reject. But what I will say, again, our company consults for over 200 municipalities. We have carriers that are on all sides of that world. So we have Blue Cross has a large percentage of our group. We have Harvard Pilgrim, who has a large percentage. Tufts, Fallon, and between Blue Cross and Harvard Pilgrim, we hear the same noise as far as that goes, which is minimal at best. I think Tufts is a wonderful health plan as well, but that seems to be where we hear most of that noise from.
And if you have a rejection and you have the trust fund, can't you, if you think you should reverse it, can't you do that on your own, or you have to have?
So part of your participation agreements basically lays out the fact that you will be so much not a trustee per se, but it's up to you to manage the financial well-being of that group, basically. So you have the option of approving that claim.
So you have the option if you think the rejection was unfair, or?
Yes.
Correct.
Who do they come to, you?
It would go to the joint board of the joint purchase group.
Likely before you even got to that board, though, it would come to us as something, and if we'd say this is crazy quickly, and we'd call, because we do have some sway with these carriers, and if it was insane and it was obvious, it would probably get approved. But if it was one of those 50-50s, or even, if it was less than 90% certainty that we should pay it, we definitely would bring that to the board.
But the insured is the one who has to initiate that.
Correct.
Like if I was rejected and I said, I don't care, it's only $50, then nothing happens. I would have to go to you and say I should get this $50 back. Is that how it would work? If it was
Correct. Yeah,
denied?
likely it would percolate up through Mary Ellen or something to that
Usually
effect.
it's a big amount,
I know, but it can be nickel and dime. They can nickel and dime you to death.
Replacement, I know they'd accept it, but suppose they did it, then you would go and complain about it, because you need the knee replacement, they rejected you.
Yeah, the only way that issues can be addressed is if they're not.
Right, you have to initiate it.
I mean,
The person.
personally, I'd go after $50, but
I would
that's,
too.
I'd have a start conversation with someone real quick there. So again, we work closely with all the carriers, and I don't hear anything percolating up through us of those problems. I'm going to go back to our office and ensure that there's not. And beyond that, we'll circulate that PowerPoint that the HPI gave, and there's some guarantees around their claims processing, which again, they have a financial stake in keeping, because they have to give us back a portion of their admin fee should they fail to live up to those standards. So again, I think we've gotten through will I keep my same plan design? Will I keep my same doctor? What's this going to cost me? So at the end of the day, when you're looking at these things, you say, all right, yes, it's a change in carrier. Is there savings? Yes. Is the changes in the carrier going to actually affect me downstream? By keeping your same doctor, by keeping your same plan design, those things certainly will be mitigated as much as possible. So when you look at a joint purchase group, you want to look at, can you avoid your peaks and valleys that we've seen within Dudley-Charlton as a smaller self-funded group? The answer is yes. That's the main reason why you want to join a joint purchase group. If you're self-funded already and you want to get into the purest form of self-funding and you want to lower your fixed costs, because again, it's your claims costs that are your biggest portion, then yes, being part of the joint purchase group makes a lot of sense because it lowers your fixed cost. If you want to attract outside vendors to be part of helping you manage and help your folks that are going through challenging conditions manage that disease state, then yes, being part of a joint purchase group makes a lot of sense. You do give up the autonomy. You don't have ultimate say over what happens. But I think because of how the participation agreement was written and because of the agreements that have been made, those are also mitigated. So any questions out there, anything that you think I haven't covered? I'm sorry that you had to listen to an auto report and then about health insurance. I do apologize.
We have people in the audience. Do you have any questions? Or you can come up to the table. You did come for a reason. Give your name and.
It's interesting that I've been elected because I'm very good at speaking in front of children. I'm a nervous wreck speaking in front of adults.
But they're a material child. so
I'm
fun.
Jennifer Hedges. I teach at the middle school, and I'm also the union rep for the middle school. And I've been getting lots of questions, and I'm one of those people that tends to try to do lots of research. So I can tell you what I found out, and I can tell you what I didn't find out, and I can tell you what the concerns are. First of all, when we look at the savings, I went to the insurance meeting, the first one, and I was handed that list of what we as teachers would save in our checks. I took the most expensive plan, which would be the PPO family, and I looked at it, and it's $30 a check, which is $15 a week. So the people in my building are like, okay, so what are we losing for $15 a week? And it's really no skin off my back to pay the $15 a week to get what I want. One of the lower ones was $12. So that seems to be a concern. I also know people, I have a story for you, I guess. I know people who have Harvard Pilgrim. And I'll give you two scenarios. I have Blue Cross Blue Shield PPO right now. I went in for a routine procedure, a preventative procedure. They had to do the test twice, and then they had to do an ultrasound. Never had to pay for it before. I get a bill from the place for the ultrasound part. I call up Blue Cross. They were wonderful. I explained the situation. I said I would not have needed the ultrasound had the rest of the tests come out fine. It's part of preventative. She said, no problem. I will call. I'll give you a call back. The next day, I had a message in my voicemail telling me it was all set. I didn't have to worry about it. To me, that's worth $30 a paycheck. I mean, coming from a teacher's perspective. Conversely, I know someone who had a routine preventative procedure who has Harvard Pilgrim. He is still being billed for the anesthesia that went along with his colonoscopy. He called Harvard Pilgrim, got well, you have to fight it out with them. Here, we'll send you this claim form. He is still getting billed $700 for anesthesia. So then my thought goes to, okay, so you parallel it and you say preventative is covered here and preventative is covered here. However, their definition of preventative could be quite different than their definition of preventative. So what kinds of costs are we really looking at? I'd like to see that, and I can't seem to come up with it. So that's a definite concern for people in the building as well as for me. Because if you're going in for something that's preventative, then you want it to be covered. And the last thing is, I recently heard that there's UMass doctors rejecting people that have United because they didn't renew their contract with United. I'm hearing UMass didn't renew it, so that now people aren't able to make appointments with their regular doctors at Blue Cross, at UMass, because they have United. So that's an issue.
Yep, so on that note, so if you're with a UMass doctor, you're in Massachusetts, you're under the Harvard Pilgrim Network there. So that doesn't, so it would make sense that United probably didn't re-up. I can't, I'm not gonna even try and speak to it, but they have an agreement, if a United person's inside Massachusetts, that they could take advantage of the Harvard Pilgrim Network, so
But
for
that doesn't seem to be what we're seeing, because they're getting told by doctors that they can't make an appointment because they have United.
Yeah, but these folks, so it's a Harvard Pilgrim card, so it goes through Harvard Pilgrim, not United. So United standalone, that might be the case, but this is a Harvard Pilgrim
Okay.
product. So I hear you, though.
So people are kind of concerned, I've been with the district for 19 years, okay? And I still to this day tell people I work here, and people to this day, it's the district people are dying to teach in. It's the district people are dying to have their children go to. And I think that we have a very good relationship with the district, and we're all invested. The teachers are all invested. And this is a very important piece to us, and it always has been, because it's come up before. So I guess I'm appealing to you to consider that strongly in the process, that it's more than about money. It's about the comfort of the insurance, what we need, and what works for us. Thank you.
So thank you very much. That was very good. Does anyone else want to speak to it? Thank you so much.
If I may, Mrs. O'Connor?
Go ahead.
So, Chris, under the scenario that,
Oh, wait, Christina
Can
wants.
I just say one thing?
Yeah.
I just went to Florida and we have Blue Cross Blue Shield and my son got the flu. And I called Blue Cross, no issues. They said it was nothing. It was a phone call and a referral, and they paid for the concierge doctor, so. I don't know who doesn't do that, but I just had the experience.
Thank you.
so the experience of having to go in and have a procedure done under Blue Cross Blue Shield, obviously it was dealt with appropriately. For our employees, not somebody else, but for our employees, there would be no difference in terms of the copay. There would be no difference in terms of what was covered. There'd be no difference in the net billing or process for if we went to the joint purchase group and had Harvard Pilgrim, HBI rather.
Yep, correct, yep, so, and I think there's also there's probably two different Harvard Pilgrim plans we're talking about. One is the standard HMO policy, right, which you need a referral to go see a certain doctor. They may have needed a referral for that and a CGL. I don't know what happened in that particular case. Underneath the EPO plan, which is what's being offered here, it's called a network plan only, so it gets rid of the referral process. It's not a gatekeeper anymore, you just have to stay within your network. So that may have helped with that scenario. I don't know what that scenario was, but just thinking outside, just thinking what it could have been, that's my first thought.
Now, in, say, what Jennifer had said with the colonoscopy, for us, if she had a problem with Harvard Pilgrim like that and they kept billing her, she would go to Mary Ellen. Mary Ellen would straighten it out, right? Mm-hmm. If she kept getting the bill and she wasn't supposed to, and Harvard Pilgrim says they're straightening it out, then you would go to Mary Ellen. Because I know I had a problem with Blue Cross, so I just went to the one that handles the plan, and she cleared it up for me. So that would be the way out, not getting the bill every month, and they're saying, you're trying to negotiate with Harvard Pilgrim. You would just go to Mary Ellen, right?
And she
Isn't
would
that the right
escalate it through
channel?
Gallagher as
Yeah.
well, yep.
Just wanted to make that clear.
Yeah.
So if you were in a predicament, you'd have to go to Mary Ellen. She would.
Happy Mary Ellen.
I guess that's my concern, though. My concern is preventative. I'm being told they covered preventative. What is the exact, their definition may not be the same.
Uh-huh.
And I believe I brought it up at that meeting, and I said, do we have anything that shows it and proves it? And you didn't have anything at that time, and I'm like, it's like signing a contract, I don't know what's in it.
So they weren't agreeing that, to the preventative then?
Right.
So what I can do is I can pull both definitions for you. I can get that off to the board, whatever the best way to do that is here. I think I could pull that off for you.
Any other questions for Chris? Anybody? How about our members, anybody? Okay, Chris, that was very informative. Thank you.
Thank you, everybody. Again, sorry for the insurance and the audit all on the same night.
Thank you.
Yeah, thanks for having me.
If I could, Mrs. LeBon, before you continue on. I would like to thank Mary Ellen Chabon. She's been participating in this process all the way through, and she has been a lifesaver in terms of her knowledge of human resources, the benefit world, the health insurance world, making sure that Chris stays on top of things and gets things out. She's just been invaluable, and it's all above and beyond the normal stuff that has to go on in the office, taking care of employees. So, thank you.
So thank you, Mary Ellen. So maybe at our next meeting, we'll think about it and then.
Next meeting will be the opportune time to have a vote if we want to pursue this.
Okay.
When do you have to have it done, the vote done by?
At the next meeting.
Next meeting.
Can I just ask a question? Have we heard, like, has the faculty taken a vote on this? Or are they entitled to take a vote on that?
No. That's why they came.
Is that information we should get?
They're represented on the Insurance Advisory Committee. So the working premise is that the Insurance Advisory Committee, representing the employees, will provide the feedback. And clearly, we've heard, feedback tonight.
They didn't get. That's why they're here this evening.
The first time we heard about the actual, what they wanted to do, was the email that you sent.
And no one had a chance
And
to
I'm a
even
building
take
rep,
a
and that's
vote
the
or
first
say
time
whether they wanted it or not.
Yeah, this has been going on for 9 months. For us to hear about it less than a month ago was like.
Because we certainly would have done surveys, we certainly would have, we absolutely would have. We weren't asked to do that, so.
That was a good question.
That's what I'm asking, when is the deadline? Definitely next week. Why is it next March 26th? Why do we have to vote by then?
Because 3 months is basically the time frame needed to make the conversion.
Okay.
Have any of the other 3 towns already taken a vote?
I believe that Webster and Douglas are all on board. I'm not sure if Stoughton was a late add-on to the process, and obviously not being close, I'm not sure, but again, it's...
On record, I'd be happy to get you to vote for my building by the end of the day tomorrow, if you'd like it.
They could have a survey for all the employees, I'm sure.
So I can appreciate that you have a certain point of view that you brought to the table, and I can appreciate the story you told could happen with any insurance carrier, and has happened to me in my insurance carrier, and I'm not in part of the same one, but I think it could have happened with Blue Cross Blue Shield. I've spoken to some faculty members who think this is a positive thing, so I don't know that everybody is in the same boat for seeing it the same way.
Go ahead.
I teach at Dudley Middle School. I don't think I'm stable. My name is Kristen Noli, and I was hired in 2005 by Greg Desto, and I have given every ounce of everything I have to the school district, and I student taught here, I did my observations here, and this has always been, as has been said, the type of district that I always felt valued its teachers as people. We're not just people who show up for your kids, we're people who show up for the kids from 7 in the morning until 10 o'clock at night. And this is why people come to this district. And I think that the biggest thing here that is freaking out the faculty in this district, who are freaked out, myself included, as you can tell by my shaking voice, is we feel for the first time, I think, in quite some time, that there has been a real lack of transparency. And that is what is frightening us, because if there's a deadline in just a few weeks or days, why have we not been approached just as a sense of a peace of mind about this whole thing? And I appreciate that you can't communicate every piece of the nitty-gritty to us as it comes, but we feel blindsided, many of us. And for myself, I just got married in September. I'm looking at the possibility of having a child. And when this came down the pipe, I was just like, oh my gosh, I think of all of the millions of specialists that is going to require. And I'm terrified of how that's going to affect me, my husband, my future children. I mean, I just ask that as you go forward with this, that please just consider more than just $30 per paycheck. Because for my own peace of mind, I would do that in a heartbeat. Absolutely in a heartbeat. And I know that other people may not feel the same way, but we want the opportunity to make that decision. And we want the opportunity to think about that before something is just sweeping changes made in a matter of weeks. We literally found out about this a week ago. So anything that you can do for reassurance for us as a faculty, positives or negatives, would just bring so much peace of mind to us personally. So, and I appreciate you giving us the opportunity and myself to come and speak today, because that is helpful to us beyond means. So thank you.
I think change is really difficult no matter what the issue is, and the more information we share with our teachers, the better. So I don't know if you can think of some things that we could share with them so that they can be more comfortable with the decision-making process and things that were discussed at the meeting, the pros and cons, and also the issue that was brought up regarding what is the definition of preventative from both perspectives. I think that would put people's minds at ease as well, if we can share that information.
Right.
Chris indicated that he'll get that definition. The PowerPoint that was presented by HPI at the meeting last week Chris is going to email that out, and we'll get that out to all of the employees. That will include the link where they can check on their doctors. Additionally, the meeting was videotaped. I've asked the town manager from Webster to share that so that we can either post it on our website or send it out to everybody so they can view it. In terms of the transparency, the committee is aware that I've mentioned this to you for about the last 9 months or so, as we've been going through it. The Insurance Advisory Committee, which is supposed to represent, everybody, has been informed that we were looking at this and the progress that's been made. Unfortunately, a lot of things did not come together, such as the final plan agreement and those sorts of things, until the January timeframe. And it wasn't really right until right before February break that we had the disruption report once a provider was chosen based on the low bid. So this information is all late breaking, unfortunately.
So how many months has the insurance advisory been talking about this?
Same amount of time as
Like
school
9
committee.
months? Okay. Now, they have a rep, right? That rep should be telling them what's happening for 9 months, even by letters, because I was a chair of the advisory committee somewhere else. And so we had to send out letters to all our members that we were representing. If they didn't, their rep should have been talking with them for 9 months.
And even though we knew you were working on this, we didn't know the plan was
Right.
going to change till
Right.
now. This is the first that we've really been presented the whole plan. So, I mean, we didn't know either till this meeting.
Right.
Well, a couple of weeks ago, you told us Harvard was bidding, so I didn't know Blue Cross didn't even submit a bid till about a week ago.
Well, he didn't have the information.
That's right, I just want to know, we didn't know much
But
either.
the rep should have been talking about it,
Yeah.
because each person on that advisory committee represents somebody. Like, there's a rep for the retirees, and there's a rep for the faculty, there must be a rep for the custodians. So these people should be informed, because they're representing these sections. And if they're not doing their job, the reps.
Perhaps you can provide the people that are here with the names of the people that are their reps so they can communicate with them.
Yeah, all of the Insurance Advisory Committee members were listed, I think, on the emails, but if not, we'll get that out.
I'd like to know too, I don't know even who's on it.
Right.
Why don't you send it to all of us?
It's okay.
Thanks.
All right, so we'll move on.
The spotlight's probably out there.
Oh, yeah, the spotlight, we forgot.
An hour later,
Those poor kids.
Poor kids.
at 11 o'clock.
Rich or
Never did knock,
Stephanie or
Pauline.
Kaylee.
Pauline, he never knocked.
He never knocked, he was
Blame it on
supposed
him.
to. He was supposed to give me a signal.
Okay.
So while the kids are coming in,
Poor kids.
break the ice a little bit. So Dudley Middle School is very excited to come in and be here for the spotlight tonight. We've got a number of students who are talking. They will be brief each, so don't worry about their sheer number. But one of the things that I'm most proud about being the principal at Dudley Middle School is not only the academic accomplishments that our students have, but really about the great people that they're becoming. And the goal of tonight is to really remind everybody about what we stand for. There are two words on the front of our building, and that's students first. It's something that's been up there for a long time. But these students are representing a number of other peers from our school who engage in civic activities, outreach, local community service projects that have a long-lasting impact. And really, what we're showcasing tonight is the great people of Dudley-Charlton Regional Public Schools. So it's my pleasure to bring up our first group, or our first student, who represents a group called Souls for Souls. That's Marina Waba. So I'll just introduce each kiddo who'll come up and they'll talk to you and share a little bit about their project or program, and then they'll go off into the background. Thanks.
Turn the microphone.
Okay, you can come and sit right at the table. Sit right at the table in front of the microphone.
Oh.
Okay. Okay.
Hello, everyone. I was in ESL with Mrs. Billis, and we did a PBL on recycling. I went to a regular class, and now Mrs. Billis and Mrs. Packard and Mrs. Bateman in the Be Better Club, a school-wide PBL. We are running the Souls for Souls while Mrs. Billis is at DES. DES is also doing the same shoe drive. We have collected over 200 shoes at DMS, 120 shoes at DES. This is our first annual shoe drive. It will continue with our second drive in September.
Wow, that's awesome. That's it, you're off.
That's it, you're done. No questions?
No questions?
We can hold questions and comments maybe till the end of the room.
Okay, good job, good job.
Next up is our Helping Hands Community Service Club. Maybe just stand right behind me.
Hi, my name is Hazel Rucci, and I'm a part of the Helping Hands Community Service Club. And today I want to talk to you about one of the opportunities that I get through this club. I get to go to the soup kitchen. And the soup kitchen to me is good food, good people, and good community. And it really made me realize just how lucky I am. Each night I get to come home to a big family dinner, and I get to just talk with my family. And many people at the soup kitchen, that's what they want to do. And you can see that it really makes an impact on them, that the youth in our community wants to participate and talk to them. And the soup kitchen has changed me for the better and taught me so many things. Thank you for listening.
So lucky to have you kids there.
Can I ask you a question? Do you cook the soup, or do you get to visit with the people that
I
are
get
eating
to
it?
visit with the people. I get to meet amazing new people. And, I've made so many friends that I never thought I would even be able to meet. It's really awesome.
And you're
That is
really
really awesome.
bringing enjoyment to these people.
They're bringing enjoyment to me. It's two ways, definitely.
It's awesome.
Thank you.
Hi, I'm Alex Journeys, and I'm also part of the Helping Hands Community Service Club at Dudley Middle School. And I'd like to talk about why I enjoy going to the soup kitchen. First of all, I just like going to the soup kitchen because I get to see people sitting down and eating a nice warm meal with family and friends, and some people just are less fortunate and can't do that, but they just come to the soup kitchen just to enjoy people's company, and I think it's really amazing that people do that. And I just think it's great that people come to the soup kitchen that can't afford to pay for their family's food and pay for their own food every night. And I just like serving them and to know that I just helped them out for a whole entire meal. And lastly, I just like seeing the smiles in their faces when we serve them because they're just so thankful for what we're doing for them. And it just makes me feel so amazing. So thank you.
Thank you.
Hello, I'm Sarah Arnold, and I'm part of the HHCSC, also known as the Helping Hands Community Service Club, as well as the Relay for Life team. We have raised, us Walkers with a Wish, Mini All-Stars, have raised over $121,000 in just 6 years. We are working hard to fight cancer and find a cure.
Amazing.
I'm also part of the Walkers for a Wish Mini All-Stars Relay for Life team, and I just want to talk about what Relay for Life really is. So the Relay for Life is a team of adults and students that come together to raise $100 each by selling candy and calendars, and we do fundraisers also to raise money to help get money for cancer. And I myself I've raised a little over $100, and I'm well on my way to doubling that goal. And I think that with the help of my friends and family and just the community, I'll reach that goal in no time. And I also wanted to just say, just like Sarah said, just us kids since 2013 have raised over $21,000, and it's just so amazing. And in 3 weeks in a row, 3 years in a row, we've actually beaten the adults in our total money raised. So thank you.
Hello, I'm Laura Orn, and I'm part of the HHCSC, and at our school we have a boutique called the Titans Trade-In, where any teacher or kid can bring in clothes or take any clothes for free. If you have any clothes, shoes, jackets, or accessories, then bring them to Dudley Middle School, and you'll definitely make some kids smile.
Thanks to the HHCSC. October Saves. This is an individual fundraiser. This is Dante Sousa.
Hello, and thank you for taking the time to listen to my October Saves presentation. October Saves is a goalie challenge where you raise money and you can make a pledge, either a flat donation or per save. And per save, every save they make, you give them the money, and then they donate it to cancer. So my goal this year was to raise about over $5,000, which I did. And I'm doing this because I lost my aunt to cancer 2 years ago. And I am hoping that I can find a cure for this.
Thank you. Mark Wachroba, Cards for Soldiers.
Hi, I'm Mark Wachroba. I go to Dudley Middle School. I'm in the 7th grade. So my mom came home from work one day, and she told me and my brothers to make cards for soldiers and kids that are in mass. And I asked my mom if I could go to my school and ask my friends to do it. And so I asked my friends, and then I went to Mr. Starr. I can't say the rest of the name. So we call him Mr. Starr. And so he said I could ask the whole school to help me with my cards. And Mr. Starr me and Mr. Starr told the whole school, and we raised over 150 cards. And in 7th grade, there's a teacher named Mrs. Samko. She made her class and my team to make cards for soldiers and the UMass kids. So she made a lot of cards for us. So our little card drive was a big success. I'm proud to have been involved with this drive. Thank you.
So Mark mentioned UMass. The next group is Isabella Poplowski and Audrey Bonaventura talking about the UMass Pediatrics Collection Drive.
Hello. Okay. Oh boy. Okay. Hello. Hello, I'm Audrey Bonaventura.
And I'm Isabel Poplowski.
And we did a toy drive to collect as many toys as we could to bring in kids in the hospital at Christmas time so they could have things to do while they were just sitting in the hospital.
Our original idea was to bring them candy for Halloween, but that idea was turned down because of their dietary issues. So then we decided to do Christmas gifts instead.
We raised over 260 toys within the course of 5 weeks by just collecting every morning before school started in our school's lobby. We originally, as she said before, with the candy, started with that, but we knew that we couldn't do that. So the toys sounded like a much better idea. Thank you to Mrs. Eagleton, who was the one who suggested that.
Yeah. For one, I like the project that we did because I feel like if you get a gift from someone, it's like more special because they put more time and effort into it than like someone just like, oh, giving you a card and money and just say, oh, you're good. But like, if you think about it, people don't always get what they want, and like, I don't know, it just, I don't know.
As one of my family friends she was 2 and she got diagnosed with cancer, and she had it till she was 4, and she would just sit in the hospital, and me and my sister actually raised money to bring toys for her, and I wanted to do something with Izzy to do something for more kids because it's not just one. There's thousands of kids stuck in the hospital at all year round, and especially Christmas time. It must be hard for parents to pay for the hospital bill and buy them toys and to keep them smiling. And yeah.
Did you guys get to bring them into the hospital and deliver them?
No. We weren't able to do that because of privacy reasons and since it's flu season, but we were able to bring them to the hospital.
That's great.
You did a good job.
Thank you very much.
This next group is something that was a brainchild of one of our 8th grade teachers, Miss Stacy Lynch, and representing that group is Kaza Slowenwhite, Cadence DeGrace, Matt Marchetti, and Mason Payne. The group's title is Where the First Graders Are.
I'm Matt, that's Kaza, that's Katie, and that's Mason. So we, as Mr. Starr said about Miss Lynch, thank you to her for bringing us to the Mason Road. It showed me how much the kids wanted to learn and to have fun, and we got to go and help them. And whatever they needed help with, we were always there to help them, like with the math or whatever they needed.
So there are 2 different groups. There's a Tuesday group and there's a Wednesday group. I'm part of the Wednesday group, And this was only half of the very lucky students who got picked to be able to do this. So my teacher that I go see is Mrs. Dinsdale. And
I go see Miss Brogna.
I go to Mrs. Marion. And I go to see Mrs. Quatermash.
So Miss Lynch drives us there at 8:40, and we stay there for 40 minutes. And we go help the teachers with whatever they need with the students, make sure that the students are doing okay with any work that they need to do. And it's a really fun experience to see them, interact with them, and just get to know them, really.
And how often do you do, how long have you been doing this, for almost the whole year?
Yeah, we've done it for pretty much almost a whole year, yeah, except for the first quarter, and we're doing it for the rest of the year.
Right?
We must
Do you
have
wish
gotten
you
to
were
see
back
live.
in first grade?
Yeah.
They must be happy to see you.
Yeah, it really brightens their day up, so.
The Be Better group with Ms. Trinity Bulak.
Hello, my name is Trinity Bulak. I'm a 7th grader at Dudley Middle School, and I'm a member of the Be Better group. The Be Better group is a group that was inspired by the words of our beloved Mr. Pear, Be Better. It is managed by Miss Packard and Miss Bateman, but is mostly student-driven. We meet together at least bi-monthly at our meetings and brainstorm acts of kindness and create plans on how to make them happen. Last year, we made fleece blankets that were donated to sick children, fleece toys that were donated to Worcester Animal Center, decorated pots with succulents that were given to teachers for Teacher Appreciation Week, and partially participated in other small acts of kindness. This year, we are doing similar activities. We have also assisted with Souls for Souls in the Say Something campaign. We decorated placemats that were used at the soup kitchen around the holidays. Around the holidays, we also created a compliment tree. We set up a Christmas tree in the lobby at Dudley Middle. The Christmas tree was decorated with ornaments that had compliments written on them. Students and faculty took the ornaments off the trees and gave them to someone they thought could use a compliment. We also made care packages for Dudley police officers to show them our appreciation for their hard work. This spring, we are going to provide coffee and donuts for bus drivers on Bus Driver Appreciation Day and possibly repaint and decorate the students' bathrooms with positive sayings. The random acts of kindness are endless, and Dudley Middle School is full of kind-hearted, creative, and thoughtful students that make them happen. Thank you for your time and your attention.
DMS Food Drive with Alec Porter and Greg Winans. And the Resistance.
Good evening. My name is Alec Poirier. I'm from Team 8-1. 8 years ago, Mrs. Eagleton started a food drive at our school to support the Webster Dudley Food Drive. She recruited Mr. Wright to get the 8th graders involved, and over the years it has become an 8th grade tradition. We call ourselves the Resistance, and it is our mission every year to try and top the previous 8th grade's number. The competition lasts about a week and a half. We need to get very creative in order to get the donation numbers we need. We canvassed the neighborhood of Dudley and asked local businesses to assist our efforts. All of the fundraising is student-driven. We set appointments, wrote letters, and counted every collected item.
Good evening, my name is Greg Winans, and I'm also on Team 8-1. This year we were able to donate over 8,500 items as a grade, topping last year's number. In total, DMS donated almost 10,000 items to the food share. Our delivery truck, on the day our delivery truck came, we stored all 10,000 items into the box truck. Then about 20 of us were able to unload the truck at the food share. Meeting the great people at the food share illustrated to us how important it is to help our community. Each of them works as volunteers and were so kind and appreciative of our efforts. The items we brought helped families right here in our hometown. As proud as we are of our record-breaking numbers, we are hoping the 8th graders post an even bigger number next year. Thank you.
So we heard about where the first graders are in reaching down to first grade. We do have a program at Dudley Middle where some high school students come down and work with our students in the library and study center. So please welcome up Christina DeBona, Kelly Canoyer, Sam Doctor, and Al Salonis. They're the study center tutoring program at Dudley Middle.
Hi, I'm Christina DeBona, and I'm a junior at Shepherd Hill. This year, I was looking for an opportunity to volunteer and found Dudley Middle School was looking for after-school tutors. I met with Miss Incato and became the tutor center coordinator, and I recruited 8 other juniors. Once a week, we meet in the DMS library to help students in grades 5 through 8 with all their homework and anything they need to do. And then I had the fortunate opportunity to be a student at Dudley Middle when Mr. Pear was principal. His message to be better continues to be a daily motivator for me.
Hi, I'm Albert Salonis. I'm a junior, and this is my second year tutoring at DMS. I may not have thought about Dudley Middle School's motto, students first, when I was a student there, but now I'm able to go back and apply that student first motto every day. I enjoy helping and encouraging the students with homework at the tutor center.
Hello, my name is Kelly Canoyer, and I'm also a junior. I think it is important for high school students to volunteer so we can gain experience working with other people. I'm preparing to apply to college, and I always look at groups, clubs, and volunteer opportunities on campus. I know that I want to continue to help others.
Hi, I'm Sam Doctor, and I'm a junior also. Although I was not a student at DMS, I have found it such a great experience to go there and help the younger students. They're always entertaining and appreciative of our help. I hope more high school students continue to volunteer at the Tutor Center for years to come. Thank you.
Thank you.
Some members of our NJHS to chat with you a little bit about what they do as an organization. Julie Traverso, Sean Melvin, Meriden Wilds, and Grace Bateman.
Hello, my name is Meriden Wilds, and I am the Secretary of National Junior Honor Society. This is Grace Bateman, our Public Relations Officer, Sean Malbuff, our Treasurer, and Julie Traverso, our President.
We are the officers for the National Junior Honor Society at Dudley Middle School. Some of the community service activities we participate in outside of school are Special Olympics, soup kitchens, the Boy Scout yard sale, baseball and soccer field prep for the town, and community harvest. We have been helping at community harvest for over 10 years and go twice a year. We both plant and harvest vegetables and work at their annual Plant-A-Palooza.
In school, we host our Halloween and Valentine's Day dance, help with the Blue Devils and Titans basketball concessions. The 5th grade spaghetti dinner, the annual Leukemia Lymphoma Society's Pennies for Patients, and 4th grade Step Up Day. We enjoy serving others, and we love to help as much as we can.
Our next two young ladies, Kaya Gray and Miranda Burden, are going to talk about a biggie, the U-Wink Holiday Collection Drive.
Hi, my name is Kaya Gray, and I'm an 8th grade student at Dudley Middle School. This year, we were involved in a community service learning project where we teamed up with U-Wink. U-Wink stands for Youth Opportunities Upheld. It is one of the leading behavioral health and education agencies in Massachusetts. They offer many different services across Central Mass. Whether the program or service is therapeutic, clinical, educational, or vocational, all of them stem from their mission to provide youth and families with bright and healthy futures. This past year, they proudly served more than 15,000 youth and family members.
Hello, my name is Miranda Burden, and I am also an 8th grade student at Dudley Middle School. The project we teamed up with is Dudley Middle School and U-Wink Adopt a Child for Christmas. When DMS started the Community Service Learning Project under Ms. Patrick's direction 17 years ago, they were able to sponsor 7 children. 17 years later, we have provided for 360 children in need. Every year, U-Wink provides us with the first name, gender, and age of the child in need. Each child is allowed to request 3
Christmas gifts. Their requests vary. Some children truly ask for basic needs, winter coats, boots, and clothing. Sometimes journals and fancy pens to write down their thoughts for therapy. And some children ask for more expensive items, but with the help from our community, we meet the needs and want of every child every year.
Thank you.
Our final guest tonight joining us is our Project 351 ambassador, Miss Lily Bateman.
Good evening. My name is Lily Bateman. I'm an 8th grader at Dudley Middle School. I was honored to be chosen as our Project 351 ambassador to assist with Cradles to Crayons. Cradles to Crayons provides children from birth through age 12 living in homeless or low-income situations with the essential items they need to thrive at home, at school, or at play. As an ambassador, I will dedicate at least a year to build unity, kindness, and transform lives and our community through service. This service project is done through the guidance of Cradles to Crayons. I, along with my team of friends and community, will be running a clothing drive to donate clothes to more than 300,000 children that live in low-income situations here in Massachusetts. For 2 weeks, we will collect donations at the Dudley Middle School, Mason Road Elementary School, and St. Anthony's Church. At the end of the 2 weeks, my team and I will sort the clothes and deliver them to a designated drop-off location. Cradles to Crayons will then give the clothes to homeless children in Massachusetts. In the fall, I will be running a food drive. I'm incredibly thankful for this extraordinary and life-changing opportunity and look forward to uniting my community through the process of spreading kindness. Thank you.
So why is it easy to get up each day and go to work for the number of teachers who are here? And thank you so much for coming out to support the kids in their presentation. This and their peers is the real reason. It's why we do our jobs. It's why we make these decisions, at this table. It's why we send the students to Shepherd Hill to meet with great success, individually, collectively, and just make a tremendously strong community. If anybody has doubt that folks in our district don't have what it takes to make great people, I'm sorry, but
Here they are.
you just got to open the eyes, and this is them along with all their friends. Thanks very much for the time.
That's amazing.
That is.
So you get reminded of why you do this job.
Yeah.
And that's why these student spotlight segments bring you back to all the other decisions you make.
It's true.
That's why I wanted to make sure we had those.
And we always try to make the right decisions for these kids. Oh, God. Okay. So next on the agenda is report of the Director of Finance and Operations, and that's Rich.
Thank you very much. We've already tackled a couple of items on my report, such as the FY18 audit. I did include the information on the Charlton water loop, which will provide town water to both Heritage and Charlton Middle School in the upcoming year. This has been a project that was long talked about in the district, and it is finally coming to fruition, starting this summer and concluding hopefully next summer. I don't know if anybody has any questions about the information here and the timelines. All right.
Just to clarify, the construction would be completed by the time school starts again? Or
That's the plan. They while you never control those things exactly, they recognize the disruption this is going to cause and are doing everything they can to minimize that for us.
But I believe the temporary repair, road repair, isn't going to be completed right away, correct?
No, there'll be temporary patch, and then
For a period of time.
the full
Right.
the full paving will happen next summer.
So-
But again, it's only paving where they're placing the water pipes. It's not paving the entire property.
But
That
that's-
would be on us.
But the temporary repair would be through the following winter. next winter?
Well, it'll be through next summer.
Okay. All right. My question is, so we'll live through the entire school year with a temporary repair. I know it's not near the front entrance, but I'm just saying, is it an area where we come in to use? Or no? Is it just the area that goes down to where they're doing the construction, or what area is it?
No, the water pipe's going to go over a good portion of the property.
Okay. Because the roads aren't terrific going in there as we speak.
Yeah.
So
Well,
my
this is-
concern is, that's my, being over there today, they're not great. So my question is, when I watch temporary repairs, as we all are seeing with every pothole that we drive through, my concern is, when I hear the word temporary repair, I just get angst. And so the period of time between the temporary repair and the permanent is how long?
From the fall till the following spring, summer.
Right. Okay.
So it's going
That's
to be
what
for
I
a full year.
thought. Full year.
Mhm.
Okay. All right. Thanks. Okay. Yeah.
The only thing else that I had for the committee this evening was disposal of surplus equipment at Dudley Middle School. They have a clothes dryer, original with the school in 2000, that is in need of repair, that is estimated to be more expensive than it would be to replace it at this point in time. We request that this be declared surplus equipment.
So moved. Do I have a second? Second. Any more discussion on it? Seeing none, all in favor? Motion carries, it's
Thank you very much.
unanimous.
That will be disposed of promptly. That's all I have for
And
this
that's
evening.
it, thank you, Rick. Okay, Budget and Finance Subcommittee report, and Kathy, you're designated.
Elaine.
And Stephanie's designated to add whatever she
And
would like.
Dr. Nash. And Dr. Nash.
And Dr. Nash.
I'll fill in.
Okay.
Okay.
We met Tuesday morning from 8:30 to 10:30. Mr. Matthew was not there because he was out at a meeting, so we had to postpone some of the discussion until he came back. But one of the things we did discuss was the district capital plan. We brought you up to speed about that a couple of weeks ago, how we had two groups came in once, and they spoke about just doing the repairs type, what we need capital, and also what we need educationally. So we tentatively, and you'll have to confirm the date, we've given the date, the DRA would come in on March 27th. Has that been confirmed at 7:30?
No, for 8 o'clock.
8 o'clock, okay. So they'll be on the agenda for 8 o'clock. But in tying in with that, we're going to ask you to start the meeting at 6:30 in 2 weeks, so we can leave enough
In
time
2
for.
weeks.
Yeah, but they're not coming till 8, but we could start the meeting, so we'll have extra time for
Okay.
them. But we'll talk about that afterwards. We also spoke about Frontline. That's the substitute program that we're looking into. Instead of having substitute people each building, we'd have that automated system. And Dr. Nash told us that a couple of the schools that have Frontline have now switched to a new company called Ready Sub. I don't know if Mr. Matthew, you have any information on that, or what the difference would be, price-wise?
It looks to be about a third of the price, but we haven't explored the actual functionality yet.
Okay.
So we'll set up a demo and see how it compares to Frontline.
And we'll just do the program for substitutes, not for teacher attendance tracking. What would that program include? We weren't sure.
It was just the
Just the
sub-management.
substitute, we won't do the teaching tracking at this point?
Correct.
Okay. We talked about contract negotiations, which we're going to executive session for later on. We also, a major thing was about what to talk about at the joint meeting next Wednesday, March 20th. We have that joint meeting with the selectmen and the officials, and we were looking for bullet points to speak about. We thought we shouldn't overwhelm them with too many figures, but just the basic facts. And we thought a couple of the issues we had discussed, and we want to fill in with us, mention what money we use from school choice, because I think some of the town officials don't realize that we're using almost all our school choice just to get through the budget. They think that's kind of in a piggy bank, so to speak. So I think you have a slide of, are you going to make a slide of how much?
The history of the use of school choice and how it has increased over the period of time.
And also E&D, how that's going. But I think those are the basic concepts. We can inundate it with the program that Dr. Nash gave a couple of weeks ago, but we thought that was just too involved. But we had a question, I don't know if you got any answer, is it going to be taped that night? We wanted to know if anyone's going to.
We haven't checked, and I'm not sure if our meetings, we have a meeting tomorrow with the town administrator from Dudley.
Okay.
Tomorrow, Friday. I can't remember. Friday. Yes. But I'm not.
They're not going to, she says.
They're not televising it, okay.
Do you think we should do that?
Can we do that?
Well, it's in our building. Next Wednesday. The thing was, Charlton is actually the one who's proposed this meeting, so it's really their meeting, it's in our building, so we thought they would be responsible for taping it, but if they're not going to, my personal feeling is it should be taped. I don't know what the rest of the committee thinks. I think-
Right.
So if you could make next Wednesday at, what time is that?
6:30.
6:30 at Charlton Middle School, because I think we should have that taped. Another thing we were talking about, administrators' contract language, we want to look at those, some of the contract language we think should be changed and updated for administrators, but we didn't really just touch that a little bit because we were running out of time. So our major thing would be frontline for the substitute program, the capital plan people coming in, and the PowerPoint for the joint meeting next week. And
also, we talked about the insurance holiday.
Yeah.
And how we would be, if we were going to do that, looking for April. And if we were to do that, how we're looking into the Into Reading program from, for the new program from K through, no, yes, K
One
through 4.
one to four.
1 through 4.
Right, so.
And how great
Potential.
it sounds, so.
Yes, and we'll schedule them to do a demo if that's the case, and we do take a holiday, and we're able to have some funds to move forward with some of the items that we've discussed with the committee before.
Do you want to explain how that works? For those who don't know what that means, an insurance holiday?
Sure. So, based on the recommendation of Gallagher, our health insurance advisor, if we have at least $2 million built up in our health insurance trust fund, and at this point, all signs would point to that, but we don't want to pull the trigger too early, the district may be in a position to grant a holiday where no payments are made to the trust fund, either from the general fund, freeing up money in our budget to pursue another line of purchasing, and for the employees as well. Nothing would come out of their checks. We could do this for one pay period, or we could do it for an entire month. Given where we are and where I expect the health insurance trust fund to be, I think I would recommend a month if we're going to do it.
And how much would that give us?
That would free up approximately about $500,000 in the general fund, which would allow for the purchase of the textbook materials.
We had a quote of the.
We'll still vote on the purchase of the textbooks.
Right.
Right, but-
Because I have not.
Right.
I have a different opinion.
Right.
Well, just to let you know, the price would be a maximum of $295,000. We thought it might be under.
That's a high price.
That's the highest would be, but they'd negotiate that.
But as I understand it, if we're still talking about this, maybe we talk offline about this, because I have a lot, I've done my own homework on it too, and I don't necessarily support spending $265,000, which was what our budget said, on a reading program that hasn't been released yet. And
Oh, it has been released, but we can talk, but we're going to have a demo for you, though.
Yeah.
I'd
So
like-
they will come in, Houghton Mifflin
As I understand
will
it,
be
it
into
isn't released until
present if
2020.
If indeed, we do have the money. Barbara?
Right now, Narragansett Public Schools are piloting that, and I met with the superintendent of Narragansett last week, and she sent me all the commentary that she received from her teachers who are piloting it. So I do have some data that I've been accruing.
The only reason why we brought it up the other day was because we would have the funds if the insurance, otherwise we couldn't even look at the program, basically.
The committee would need to vote, Mrs. Terry, you're exactly right. And so before you make any kind of large expenditure on that, you would want to see what it has and see the program, if indeed we have that. And remember, these funds are funds that unfortunately can't be used, they're not sustainable, so they can't be used for personnel. So we're also looking at, as you know, the general ledger software. And that would be something that, if indeed these monies are available, we would bring forward to you. The committee would make a decision on any of the funds that need to be, that we would wish to expend in any manner, whatever that would be.
Just one question for Rich. And this doesn't change, having a insurance holiday doesn't mean the coverage is lost for people for 1 month, correct?
No, that is correct. The holiday is simply the payment holiday, not the coverage holiday.
Because there's quite a bit of money in the trust fund, so. And that's
Anything else you want to?
conclusion?
I think that's it.
That's it?
I think that's it.
Thank you,
Yeah,
Kathy.
meeting in
Thank
2
you,
weeks.
Stephanie.
And we're meeting 2 weeks again from yesterday.
Okay, policy review subcommittee report, consideration to amend district policies, School Admission Residency, and that'll be our second reading and adoption. But Mary, do you have anything to say on the policy review?
I don't have anything new to say on this policy.
No,
I
but
did want to
yeah.
say that we did meet on Monday again for Policy Review Subcommittee, went through a number of policies. We plan to bring forward several for our next meeting.
I have a question, just a recommendation maybe. When, in negotiating with the teachers, we have talked about the policy, we had, if they're out for 10 days, they go to I think it's sick.
Yes.
Maybe you should look at that, since that kind of.
That is on our list.
Okay, good,
Yes,
because that
it
ties
is.
in with this negotiating.
If I could add, nothing has changed in the first reading that you would have that was in red, so none of that has changed. But as you know, the areas that we made changes to primarily were in the verification of residency in the columns, the evidence that we collect for residency, the difficulty that we've had potentially in trying to use, trying not to make this exclusive and make it more difficult for people who are indeed moving into town, who may not own, may be on a short-term kind of rental month by month, and therefore would not have the document that the prior policy requires. We also have added a section that was not in the policy, and that was the section, again, that you received at the first reading, which is the verification of residency for individuals who do not own a home or lease, and have made that a little bit more stringent by requiring the person with whom they share housing to also appear. In addition, prior to that, it was simply they signed and we had something notarized, but also to then provide documents that show that they do indeed live in the home they say they're living in, and providing that as shared occupancy. So nothing else has changed. Those are the same. I think the wording under here, I cleaned up a little bit, reread it.
I think 5.1A, it wasn't changed. It says students enrolled in Shepherd Hill under special programs. We're going to change that to Dudley-Charlton Regional School District in case we have school choice in other grades.
Okay.
It's 5.1A.
5.1A.
The first line, students enrolled in Shepherd Hill, I think we're going to change that.
Okay, it's on the third page.
Okay, yes, I see that,
It should
okay.
be changed to Dudley-Charlton, because it might be more than just Shepherd Hill students if we have
That's
school
right.
choice, so just
Yeah.
change that,
Yes,
just a minor
that's right.
change.
Yep, thank you.
Thank
you.
Yep,
Anything else, Kathy, on this?
that was what I had thought before.
Okay, so first I'll entertain a motion to waive the reading of policy, JF. Do I have a motion for that?
Second.
Okay, discussion? Seeing none, all in favor? Motion carries, it's unanimous. And now I will entertain a motion to approve JF School Admission Residency. This is our second reading, and it will be adopted
With the change.
with the changes, right.
So moved.
Second.
Okay. I think Stephanie said it first,
Okay,
yeah.
go ahead.
Stephanie, you had said so moved first, so that'll go in the record. Doesn't matter. And second, Mary. Okay, any more discussion on this? Seeing none, all in favor? Motion carries, it's unanimous.
Thank you.
Okay. So we have an adopted policy. And thank you, Mary and Elaine.
You still in the letter A?
For all the hard
We're all over
work.
the place.
Yeah.
We're all over the place based on what is
relevant,
most
yeah.
important.
And thank you, Mary, for your hard work, and Elaine.
And
And
Dr.
Dr.
Nash
Nash.
and several staff members.
Right. Oh, good.
Absolutely. Couldn't do it without them.
Okay. Let's see. So we will jump down to H, so the people that are waiting. Consideration of requests for first-time use of facilities, policy KF, and Dr. Nash, you
Yes.
speak on that first.
Sure. As you know, the school committee has a policy called use of facilities. As part of that policy, in the second paragraph, initial requests for use of school facilities for any events by non-school groups must be approved by the school committee. So this evening, we have two individuals representing quasi-group and a group, I believe, are here this evening. If you'd like, they can speak to their request, or you have them in front of you. You have,
we can ask them
and you can ask
questions.
them any questions.
Right.
So you have Michelle Mandela, who's here, representing her dance. I would love to be part of this
Michelle,
dance group. No, I can't dance. I know. Can't dance, can't sing, as I said before.
Michelle, you can come up
Yeah.
to the table in case we have any questions on it.
But,
Uh,
A long time since I've sat at this table.
So this will be a one-time,
Yep, it's basically just a dance recital.
Right.
It's those of us that didn't want to hang up our shoes but got
And
old.
continue to
And we're
dance.
still dancing.
Right.
Yeah, so that's what this is. It's an opportunity for us to strut our stuff in front of our friends and family. It is open to the public. We
do
are
you have a
raising.
policeman? Do you usually hire one when it's open to the public?
We're just a dance
Just
recital.
wanted to make sure, but.
No, I don't think so.
No.
No, the funds that we're raising do go for a scholarship for an adult dancer.
Okay, how about the custodian? We need one.
We have one, and he has volunteered.
He's volunteered, okay.
Yes,
His wife dances with me.
Because of, yeah, right.
That's why.
So he has no choice. He's going to be there. He's going to be there anyway.
That's right.
Right, and this is April 6th was the date, right?
Yes.
4:30 to 9:30. Wow. And how many people?
That dance?
Yeah, that dance.
We have.
I'm just curious.
We have 20 adults that dance of varying levels. I have several beginners.
And varying ages, might I ask?
Yes, you might ask. And I will not tell you how old I am, but I am
Oh.
no spring chicken, I assure
Oh,
you.
please.
You should
Sounds
come
like
join us.
fun.
Yeah, we do. We
My
have tap.
I have tap shoes, you know.
Oh, come take our
But
tap
I can't
class.
tap,
Yeah.
but I would love to.
We have a beginner tap class.
Oh, I tried that, but I'm not very good at it. I'm not. I have them.
Any other questions for Michelle before we take a vote? Okay, I'll entertain a motion to approve the use of our facility for dance.
Second.
Discussion?
I just have a question, and I asked it a little bit, but, so in normal circumstances, when we don't have to, like, when we have to pay a custodian, do we normally pass on that custodian's fee?
Oh, yes.
Yes.
Okay. There's a minimum amount of time that a custodian, minimum hours, so yes. So when the application is sent in,
Yep.
it's reviewed, we determine the fees need to be assessed, it gets passed on, that group, individual, whomever would pay those fees, and,
Okay.
right, yes.
Any other discussion? Seeing none, all in favor? Motion carries. It's unanimous.
Thank you
have
very
it.
much. I appreciate it.
Have fun.
Have
Thank you.
fun.
Come see us.
Oh, no.
Okay.
The costumes are the best. Oh, yes, this is Sherry Zanka.
Okay.
Right.
Sherry?
Okay, no, I don't think she's here this evening.
No.
Oh, there she
Here
is,
she is.
okay, I know I emailed you this afternoon, so I
Hi,
know.
how are you?
So-
Good, how are you?
Fine.
So Sherry's here this evening. She's forming, I think it's new, isn't it?
Yes.
A co-ed adult volleyball. Another thing I love, I have to tell you, I used to play collegiately, so,
Yeah.
but I'm not good at that anymore either, so I know. No, but I saw this and went, oh, wow. So she's looking to use Heritage School Gym on Fridays.
How many Fridays? Oh, no.
I have the dates.
Yes.
There's about 11.
Right, so that will go to the principal to ensure that those dates are available. So you'll have that, because when I communicated with Sherry, she said we need to have the dates to double check to make sure she had gone ahead to do that. So about 15 to 25, you really have quite a few people then, a few
Yes.
teams, right.
Do you already have the people? I have about half of them, and then just kind of, in case.
What's the timing?
We spoke to Mr. Tittle over there, and the gym is available from 6:30 to 9 p.m. on Fridays. And he did confirm with me today that they do have staff until 10 p.m.
So one of the questions I had was, obviously, if we needed to have a custodian there and their work hours on a Friday weren't as late, that cost obviously would be borne by them. Also, they would be putting up the volleyball nets, that type of thing, so.
And there's nothing going on during that time?
Mrs. Pastore signed off on Fridays in general prior to my asking to get the specific dates, which Fridays. So I'm assuming since she had signed off on it before, in a general sense, evidently there is not, but we will definitely go back, check those dates with Mrs. Pastore to make sure that there's availability, so, yeah.
Yes, I needed to wait until basketball was
Right.
over.
Yeah.
So now it's over, as of the 12th.
So we'll have to go back and make sure.
Right,
We'll
and,
do that.
and the kids don't use it on Fridays for
Evident-
anything, so you'll have to
evidently,
check on that.
The principal is the one that, starts, and that's the first step in checking to ensure that it's available before they come to us. Yeah.
Okay. So I will entertain a motion for the policy that I have to approve the use of our facilities.
So moved.
Second.
Okay, any more discussion on it? Seeing none, all in favor? Motion carries, it's unanimous.
Thank you.
Okay.
Where would people contact you if they wanted to join?
Well, I have a kind of a Facebook page now, my husband and I, and there's a few other people. And at this point, I've just reached out to people that I know, and it's kind of word of mouth. So that way we make sure that everybody's in the district and, you know,
Fair enough.
what have you.
Thank you.
Good,
Thank
thank
you.
you.
Thank you.
Update on high school program of studies, and that's Bill.
Good evening. So I emailed over to Sandy, I think she forwarded to you, just the draft of the update on the program of studies for the high school. There wasn't a lot of updates, it was really only additions. First thing that I wrote about was we separated it out to make it look a little cleaner in terms of the biomedical and the engineering certificate programs. It makes it a lot, their own separate certificates with Project Lead the Way coming in next year with engineering. It made it look a lot cleaner. We also added 2 certificate programs, the Communication Certificate Program and the Criminal Justice Certificate Program. And then the requirements for the program are under there, which we're really excited about, both of them. We're making some great connections with the Dudley Court. The judge comes over pretty frequently, for a good reason, to speak to students, and there's a nice buzz going on right now, and there is a core group of people that are interested in that. He's coming next week, I believe, to talk about business law and so forth. So the other nice addition within the criminal justice was the Charlton Police Explorers, which would be open to Dudley and Charlton students, as well as the Summer Police Academy in Webster. So those are going to be really nice additions, and we'll continue to reflect on them and develop them as we go. Questions on that so far? No? Okay, I will move forward then, Pauline. New courses. We're going to be adding a Journalism 2 class. Our Journalism 1 was very well received. They wanted more. So we developed the Journalism 2 class for next year, half-year elective. The independent reading, this is still getting massaged a little and molded, but it came out of a need and the thought around the lost art of pleasure reading for kids nowadays. So we're still molding that a little bit more, and well, I'll give you updates as we go along.
Who would supervise that? Would be a teacher's duty, or would that be a teacher's actual class, so to speak?
Well, it's independent, so it would be mainly the librarian, another teacher. It's really grown from the book club that was developed over the last couple of years. So we're trying to add some rigor to it and a rubric to it and so forth. So, but it really is about the lost art of pleasure reading.
Sure.
Next one was our stats class. We found that there were many students taking AP stats that just couldn't keep up with that rigor. So it's just an honors level stats class that we're adding.
The prerequisite, I think, what does that mean? Either taking, you used the word there, is it algebra? See the prerequisite, either taking what?
Either taking and
It
maintaining.
doesn't go with the
Algebra 1, level 1.
Yeah, it goes with that, but I think I repeat it, either taking Algebra 1. You know what I mean? Put the word, either taking Algebra 1, level 1.
Gotcha.
Because it looks like it should be something. I know it goes there, but I
Yep.
think you got it.
Um,
I just have a question on that. Would that replace, or could that take the place of another math class? Like,
Yes.
could you take that
Yep,
as one
no,
of your core math
it's a,
classes?
it's a core math
Okay.
class. It's a great question. You're gonna be here for 2 years, you know that, right? You're a junior. The zoology class and we began a zoology class this year that was unleveled. And through a lot of reflection, the science department thought having an honors zoology class and a college prep, which really is the structure of the animal body, is a college prep zoology class. We're hoping to build upon that and really tie in Tufts veterinary clinic and really expanding that a little bit more. Next page is medical interventions. It's our third class in the biomedical Project Lead the Way. It's our third year, so that'll be the class that we'll be introducing next year. We're very pleased with this pathway and certificate program. A lot of kids have taken the first principles of biomedical science, and they take human body systems. So we know this third one, there's going to be less. So, you know, if we have 5 sections of principles of biomedical, we're planning on 2 or 3 of human body systems. I know Kaylee was in there today. I observed that class today. And then this class would probably maybe 1 or 2 sections based on, because it does get very rigorous. The fourth one, which will be next year when I'm here presenting, would be medical innovations, which is really a capstone project that would take over. The next class is the first year of our Project Lead the Way engineering. This is really just taking the place of our engineering for the future. It was a half-year elective class. This is now becoming a full-year class. Right now, there's 4 sections of the engineering of the future. We're hoping that we have 2 sections of this class that would build upon that 4-class track that we have. And I think the last page of the program was the Project Lead the Way kind of pathway that we had. The middle of the Project Lead the Way gateway is really, I wanted to mention that we have started some Project Lead the Way classes in the both middle schools. So the hope is over the years moving forward that maybe we think about moving it into the elementary schools as well and have a nice tiered alignment there. The last 2, that is 21st century manufacturing, really important. This is really just a renaming of the course that we have right now. But that will become, in 2 years, the Project Lead the Way computer automated manufacturing, which is really where the industry is going. I'm super excited about that class. We're hoping to get a grant that next month I'll come and talk to you about, a large grant that we're going to rework some of the space that we have at Shepherd Hill to really create a nice fabrication lab within the building. So I look forward to presenting that to you. And the last class is really just advanced digital photography. Our photography and arts department has just been growing over the years, and our Digital 1 and Digital 2 really has kids are taking it much younger in the grades 9th and 10th grade, and we needed something for them to do. And this is really almost an independent class. We don't see a lot of kids, maybe 8, 9, 10, and they'll be really continuing on with that. You know, we win a lot of awards across Massachusetts in terms of photography, and it's really, we have a dark room, which I don't know if they use it anymore. It's like batteries that, but it is a lost skill, and it's a wonderful, wonderful class that we have going there. So that's really it. We didn't really do a lot more to the program of studies this year. So,
Any questions? Okay, I'll entertain a motion to approve all the additions that Bill has brought forward for Shepherd Hill. Okay, discussion?
Just want to say it's a different high school from even 5 years ago. The courses you're offering, it's amazing. It's amazing.
And I'm pretty much going to tell you, 5 years from now, it's probably going to be more.
Yeah, it's amazing how it's
maybe we'll be in a
changed.
new building.
Well.
Hope so.
Or a remodeled one. I'll take a remodeled. The footprint of this building is good.
It's good.
I would take a remodeled building. But new's better. Both towns deserve a new building.
Right.
Okay, thank you.
Any other discussion? Seeing none, all in favor? Motion carries, it's unanimous. And last on the agenda is consideration of requests for home instruction, policy IHBG. Dr. Nash.
I bring forward this evening for the committee's acknowledgement the following homeschooling request. We have a student in grade 7 in Charlton and another student in grade 7 in Charlton. And you have the other information that goes along with it.
And you're recommending?
Yes, yes.
Okay. I'll entertain a motion to approve the home instruction.
So moved.
Second.
Discussion? Seeing none, all in favor? Motion carries, it's unanimous. Next meeting dates. School committee meeting, Wednesday, March 27th, and it'll be at the Charlton Middle School at 7 p.m.
6:30, okay, that's when we want to start early for that reporter to come in.
Okay.
That's okay with everybody, is it
What-
okay? Is that too hard?
That's gonna be
Sorry,
tight.
what is it for?
The capital planning group is going to come at 8, but we thought since it takes so long, we'd start at 6:30 and get some of the other work.
Yeah, is it
If
going
you
to
can
take
make
that
it.
long,
I
or
don't know,
can
what do
we
you think?
just do it at 7 o'clock?
What do you think? We had thought about that in the meeting, but you weren't there, so we didn't really know.
We can ask DRA to limit their presentation to about 20 minutes or so,
Well, that's
15, and a couple of minutes for
Okay.
questions.
Because that might be hard.
All right, then,
We're
we
always
didn't know- we didn't
changing
know
the
what it was. I
time.
know, but
That
we
could
didn't know.
also be a
Started
public hearing on the budget.
There's a
Yes.
public hearing at the budget, too.
And we have Ma's presentation, school choice, joint purchasing vote. It's a heavy meeting. That's the
But
only-
I see this, we start early, we still end up late. So, I mean, what does the committee, do they want to go at 6:30 or 7? What's the committee's wishes, because she's going to post it.
I'm okay with 6:30.
Okay, Jamie,
I can make 6:30 that day.
Kathy?
I can rearrange.
Rearrange things.
I'm okay with 6:30,
But,
but let's cut it shorter on the other.
I
end.
know, on the other end, we
It's
we
getting
just,
really long.
yeah. Because the other night, we started at 6, and we were
Yeah, but you
still
think
out
we
at the
didn't start
same
at 6, we
time.
would have been going to 1,
I know.
right? I mean, the business takes 4
But
hours.
Kathy has to rearrange, you know, when you plan for 7.
I know, you gotta
Why,
change
is it
that
okay?
policy.
Start at 9
Okay.
and we'll figure it out.
So we'll start at 6:30 then, okay? It was 7 on the agenda, but changed to 6:30, okay, on March 27th. And that'll be at the Charlton Middle School. Budget and Finance Subcommittee, committee meeting will be Tuesday, March 26th, and that's at Shepherd Hill at 8:30 a.m. So that's our Budget and Finance Subcommittee meeting. And the Policy Review Subcommittee, Mary, do you have a
Is
date?
Monday, the 18th of March, at
Okay.
9 a.m.
Okay. Monday, March 18th,
9 a.m.
and 9 a.m. Okay, future agenda items, vote for final FY 2020 budget, Mars update, school choice consideration, joint purchasing group report of the policy review subcommittee, update on teaching and learning,
We're pushing that to the April 10th because we have such
Okay.
a busy agenda.
We're going to push that to April 10th. And the DRA presentation. Okay.
We also,
Anything else?
well, just a meeting date, we should put in about the joint meeting on March 20th.
Okay, we have a joint meeting at the Charlton Middle School on March 20th, and that's at 6:30, is that?
Yes.
6:30.
School choice, too. We have to.
Yes,
Okay,
that's on the
school
next
choice.
meeting. Yes.
Anything else?
Dr. Nash, did you want to bring up the food services presentation?
Yes, we will, but I think you had a young
Oh,
lady.
yeah, I
Okay,
was just curious.
Haley.
Miss Terry had previously commented on, I don't remember if it was last week or 2 weeks ago, looking into nicotine detectors in the high school or even the middle school. I didn't know if we had looked into that yet.
We didn't, but I've been reading about it.
Okay.
Dr. Nash actually looked into it and does have some information.
All I have, the only information I have is the cost. And then I did have some conversation around their use, but I'm not an expert.
Do we want it on the next agenda? Will it be ready?
Next agenda's fine, yeah.
Next
Okay.
agenda's
Yeah,
fine.
we can.
And I've had some conversation, although you may be able to bring some more light to this, about how well needed they are, and it seems that they're extremely well needed.
I mean, you can't, with the issue of having like teachers, you can't have a teacher in the bathroom at all times to make sure that kids are behaving themselves, but it's also not fair of the students who use the bathroom properly, I guess you could say. I think last year we had to lock the boys' bathroom door on the second floor. No one could use that bathroom because it was such a problem. So yeah, I mean,
That's good.
even the teachers can't always be there all the time, and you're not going to have a bunch of kids telling on
Right.
other students either. Like, that's not a comfortable situation. But I've heard around other schools it's definitely
It's a good
makes the
idea.
bathrooms a better environment.
I think we'll have administrators at the high school weigh in on it, because certainly they're the ones that have to, ensure that it's going to be something that it makes sense. Because we would need to spend $1,000 times, I think, 10 bathrooms to put them in. And the question that you have is, by the time that happens and that signal is sent, the student is gone. So the reality is, unless you probably are putting cameras outside those bathrooms, catching them.
That's not what VPAS's experience was, though.
Well, that's the conversation I think that, yeah.
You're talking about the bathrooms,
Are you allowed to put the cameras in the
No,
bathroom?
not in the cameras would be outside.
The original purpose that this company developed this device was for bullying.
She knew that it
It was
would be
detecting
locked.
sound. So the geniuses of this company said, we'll get more money marketing to vaping. So I belong to a principals group, and 2 people out of the principals group, there's probably 30 of us, it's the Midwalk principals. And one of them, Plymouth, not a group, but Plymouth North is using it this year. Another school, I think, is using it this year. We're all waiting to see what it's going to be like after a year. Because it's really, if we're going to spend $12,000, I need 5 cameras that don't work in the building before that. There's one school that bought one. I hope I'm not, this will be on TV, so. He bought one, and then he made 8 others in his 3D printer and just put them up as fakes in the bathroom. Now, I'm not saying we're going to do that, but I'm up for the discussion, but I really want to wait for the data and see what it's, because all it does is ping the assistant principal, and they're going to run, and it's going to be over. We're constantly talking about it as principals, but what's the best way to kind of deal with this? Because every school, I'll tell you, 6 years ago at my old school, we took the doors off the bathroom. And it was still privacy or whatnot. That took it down a half a notch. We got to put our heads together for something, and spending the money, I'm not really sure.
Have airport bathrooms. So all of our new
Right.
schools have no doors in the airport, bathrooms when we built. And
Right.
that was part of that discussion, to do that. But
Because essentially, I know there's a discipline factor, and then there's the children that I've talked to, and I
Yeah.
call them children even though they're young adults, that are not going to the bathroom during the school day because they don't want to be exposed to that. Well, that's not a solution for their bodies either.
Not at all. Not at all.
And so, but also, if we can impact a child from doing that and beginning something like that at such a young age, we could really make a difference to their health in
Yeah.
long-term effects, so.
Yeah, and it's not. I would tell you, I always throw out stats of, 89% of the building isn't doing it. They're not. It's that 11% that are constantly doing it, that we know who they are.
Mm-hmm.
We talk to their parents. We try to develop a plan. We exhaust every effort, and the behavior just doesn't change. And we're looking at. I pitched a vaping diversionary program to have Harrington Hospital pitch it as a group that they run,
Mm-hmm.
that parents have to go to and students have to go to, pay a small fee, and that would reduce the suspension.
Okay.
That still is percolating around somewhere. So there's a lot of different avenues that we can explore with that.
Okay.
And I'm up for the conversation.
Great.
Thank you.
Yeah.
Thank you.
Okay, and if we think of anything else, we'll add it to the agenda.
oh, good. Then what time would you like to get out? Because we'll have executive session too.
Okay.
I know, you're right.
We will be entering into executive session to discuss strategy with respect to collective bargaining or litigation if any open meeting may have a detrimental effect on the bargaining or litigating position of the public body and the chair so declares. and to conduct strategy sessions in preparation for negotiations with union and non-union personnel, Dudley-Charlton Teachers Association, and superintendent-elect contract and salary. And we will reconvene into regular session to take votes if necessary and adjourn. So I will take a roll call.
Yes.
Yeah.
Yes.
Yes. And we're in executive session.